Hello? Okay, we have 13 people here. Yeah, good evening. Can you hear me? Hello? Yeah, good evening. Hello? Can you guys hear me? Yes, okay. The other day I was having issue with the volume. Some students were not able to hear me. Oh, sorry. I wasn't around, so I just came in not too long ago. How are you guys doing? We have 20 people here. Where is everybody? You didn't know? That's the idea. So you should I will encourage you guys to, when you subscribe to the channel, click your notification. You click notification so that anytime I have channel, I have live, you can just come on and know if it's something that concerns you, right? Because some of you may be doing AP1 or AP2 with other professors, so I may not be able to send you the links. So it's easier for you if you subscribe and also click the notification bell. That notification bell is very important. You messaged me. Oh, okay. Yeah. No, this is mathematics. Let me see. I can't see the message you sent me. Okay. We are 23. Where is everybody? Okay, on WhatsApp, yeah, but they should see it on Canva. They should see it on Canva. They know now that we are supposed to start earlier. I was supposed to even start by 7. It's just that I came back late. So they have to be here. I'll give them just a few minutes, and we can let me set up this thing as soon as possible. You almost? Why? I sent a message, so you should get it as an email. Put the notification so that you will not miss next time. Oh, okay. Okay. So today we are discussing equipment for dosage measurements, interpreting medication orders, interpreting medication labels and package inserts, and safe medication administration. Okay. I'm not the one that makes it hard. It's hard to write in the chat. Really. I was taking a shower. Just spoke with a classmate who told me that. It's not me that makes anything difficult now or easy. Left for me alone, you will not even be taking exams. Okay, guys. So we're up to 29 here or 30. We have to start because we don't have much time. We can't wait for everybody. There are some people that won't be here, so they can easily go watch it later. So I'm going to share my screen so that perfect. So sometimes this thing lags, right? So once it starts lagging, please tell me so that I can do something about it. Because last time when I was with the anatomy students, it's completely stopped moving. Completely. Yes, I will send the link to Canva once we are done. I will just upload it to Canva the way I did the other one. Oh, I didn't do the other one like that, but I will upload this one. Don't worry. I will upload this one. Okay. So I guess we can start now. We are starting with chapter 8. I'm going to be very fast today. All right. The faster the better, so that we can finish off and finish up and leave. If you have any question, remember to put it in the chats. All right. So the first chapter is chapter 8, dosage equipment for dosage measurements. Extremely important chapter, because in the chapter it's all about recognizing medication dosage volumes in different enteral equipments and also in different parenteral equipments. All right, and also other forms of administration. So the key terms you have to know or you'll be tested on will be ample, calibrated spoons, calibrations. Sure, I will. Calibrations, cartridges, eccentric, enteral, hypodermic, syringes, inhalants, installations, jejunostomy tube, and leading ring. Not just leading ring, even lagging or trailing ring, rather, trailing ring. All right. And also PEG, that percutaneous endoscopic tube, then transdermal vial, meniscus, MDIs, that's metered dose inhalers, nasogastric tubes, and parenteral. You need to be very acquainted with these things because in the clinic, they will ask you. And as I told you, if they ask you a question in the clinic and you don't know the answer, and they ask you who is your professor, please don't call my name. Don't. But if they ask you a question and you know the answer and you get it comfortably, authoritatively, they'll be like, oh, wow, I'm impressed with this person. Who was your instructor? Nchebe. Please. You guys should not forget this information. No? All right? Yeah, parenteral bypass, parenteral bypass GI tract. Okay, bypass GI tract, yeah. Okay. So to introduce, it's very, very important for you to know the proper dosage so that you don't kill someone in the clinic. All right. And calibration is very, very important because it allows you to measure the amount of liquid in a container. So most times when we do the calibration like this, you look, when you are looking at this, put it in your eye level. All right. And where you are watching is the lower part of the fluid or the liquid medication. That is, we call it the meniscus. That's where you calculate. That's where you should be touching the calibration. All right. Now, the equipment, some of the equipments that you need to know for enteral medications are the medication cup, the droppers, the calibrated spoons, the oral syringes. So I should not make the exam hard. Please don't make me laugh this night. I really don't want to laugh much. Okay. Stop. I want to be serious. So medication cups, all right, metric, household, and apothecary system. We discussed these three systems last week, and I believe you will understand it. Listen, this thing is a sequence, all right? The first time we discussed the fractions, the decimals, and all those things. It led us to the next one when we discussed the metric system, the household system, and the apothecary system. So today we are using these systems to discuss what we use in the clinic exactly. All right? So that's the point of this discussion. So it's always good for you to remember what you did last so that you'll be able to, carry it over. All right. So one of the rules is that you should not use medication cups for doses less than 5 ml. So for these doses less than 5 ml, you see a question on it asking you about this. All right. Your questions are usually superficial. Nobody is trying to test if you know the constituents of a particular equipment. Nobody's testing that. All right. It's just very superficial questions that your professors you always ask in this particular topic. I'll show you some of those questions. So to ensure accuracy, use dropper, calibrated spoon, or oral syringe, especially when you are giving a dose that is less than 5 ml. All right, seriously important. So now discussing these three things, I'll just run down. These are droppers. If you look at it, you see droppers because you see images in your exam. So if you see an image like this, you should be able to know, oh, this is talking about dropper. All right, and dropper is just to measure a very small amount of medication. And usually we use those medications for the eyes, ears, nose. All right, or sometimes oral if it's a pediatrics. All right, so that's for droppers. Then when you are talking about calibrated spoon, we use it for both pediatrics and elderly patients. It's used to administer medication directly into the mouth, or you put it inside the food or the beverage. But you have to measure it with calibrated spoon, not with the spoon you use in your house. All right. Most importantly, patient education is very necessary. All right. You are always tested on patient education as a nurse at all time because you are the ones that are closest to the patients. So patient education is always required for you. Understand? And it reduces the amount of mistakes patients make, especially for medications that they have to take home. So you have to tell the patient to locate the calibration, tell them how to use the calibration. You have to even tell them, to demonstrate it for you. All right. So, and all these things follow for patient education. I'm not discussing it. Sorry. I need to be extremely fast. So this is still talking about instructions you give for droppers. This is instructions for calibrations, calibrated spoons. Now this is oral syringes. We use it for quantities less than 5 ml as well, right? So safety features. If you look at the diagram here. Okay, first of all, before we look at the proper diagram, see what is mentioned here. Anytime you hear needle on the syringe, know that you can never use it for mouth, for oral. As far as there's a needle on it, you can never use it. Even if it's an emergency, you can actually remove the needle and use that same hypodermic syringe. That's what this place is telling you. Normally, we don't use hypodermic syringe. We use oral syringe. But in case of emergency, you can use a hypodermic syringe. But if you want to use it, it must be without the needle. So if they give you option and they're asking you about oral syringes and you see any option that has needle, please know that option is wrong. It's as simple as that. All right. So these are tubes like nasogastric tube, PEG, jejunostomy tube. If you see it, you'll be able to know. So I'm jumping these things because we have a lot of questions to treat. So these are parenteral administrations. All right. So topical transdermal medications, inhalers, sublingual, and injections administered through the IV, IM, ID, and SubQ. ID is intradermal. Very important. These are the standards, all right? Usually around 3 ml in terms of capacity, and it's very calibrated. You need to know the diagram very well. They always ask you, so that if you look at it, you'll be able to recognize it. What are its parts? All right. First of all, the barrel is zero calibration. It has a leading ring and has a trailing ring. This is the diagram here. So because you may see this diagram in exam. I'm saying it right now. You may see this diagram in exam. And usually when they give you this diagram in exam, they can label A, B, C, D, E, F. You have to know what each of them stands for. This is a plunger. So right now you can close your eyes and try to say it out so that you don't forget it. This is a plunger. This is the trailing ring. This is the leading ring. This is barrel. All right. This is the barrel. This white parts completely. Then this is the syringe hub. Right, where you attach the syringe to the needle to. This is the needle. All right. And this is the needle prevention safety device. So that's a hypodermic syringe. This is pre-filled syringe. All right, the one that has already been filled before even bringing to you. And this is the rule. Examine the markings to determine whether the syringe is calibrated in milliliters or milligrams. You have to know. When you know this, you are now able to calculate accordingly. All right. So we most like the example is insulin syringes. You can see U100, you can see U50. Depends on what the capacity you are getting is. This U100, this U50. So you should be able to know. All right. Never use any type of syringe other than an insulin syringe to measure and administer insulin. Don't go and use hypodermic needle to measure insulin. All right. So we have tuberculin syringes as well. We usually use it for subQ injections, ID, and doses less than 1 ml. So if they ask you doses less than 1 ml, please think about tuberculin syringe. Right? These are some of the things we use we use tuberculin syringes for, like the PPD skin test, the vaccines, heparin, pediatric medications, and other things. All right. So just look at it. Everything is talking about calibration. Calibration. Right. So this is IV ports. Very, very important. So syringes for established IV lines. We have very special syringes, and these are the advantages. All right. The advantages, like elimination of repeated punctures, removal of risk of needle stick injuries, and other things. I don't want to go into these things. And large capacity syringes, we have 5, 6, 10, 12 ml. These are large capacity syringes. This is 10 ml syringes. Very, very common. Extremely common. That's what you see most often in the hospitals. Okay, talking about cartridges, ampoule, and vial, you need to know each and every one of them. So look at this diagram. If you can see my page, look at the diagram properly, and you should be able to identify which is which. So you should be able to identify which is which. They can give you this thing in exam and ask you, what is this? This is ampoule. This is vial. And this is cartridge. Okay, so looking at each of them one after the other, cartridges are usually prefilled, all right? Prefilled, and most times one dose. Examples is this Tubax and Capujet. Most of you must have seen this in the clinic, I believe. Ampoule is this one that nurses always used to show experience. If you see an experienced nurse, she will just take this ampoule, straight up, chicken, no stress. But if you see a nurse that is just starting, most times when they try to do it, they will scatter it. It's just break. Sometimes it's even injures them. All right. But ampoule, if you look at ampoule, you see that place that is bluish. That's the place where you can easily bend it and it will cut. It takes experience. Trust me. Most of these things are things that you learn on the job. All right. That's why I don't really stress students a lot, to start learning everything right now, because trust me, when you go to the clinic, you will learn things without even being told, without even studying for those things. You will just learn them. Why? Because those are the things you see on a daily. All right. So these are ampoules. I used to hold dosage of medication. You snap them open and use a filter needle to withdraw medication. All right. Then these are vials. Vials, always having this rubber. So immediately you see this one that is stunted and short like me. You understand? With a rubber at the head, you're always talking about vials. All right. They contain powdered medication most times, so you mix in them and you're able to use it properly. So these are exceptions to the rule, to prepare rules, exceptions. Pharmacy technicians could prefill medications. Okay, no, before that, this is preparing medication for someone. Don't allow somebody to prepare medication and give to you, especially another nurse. There are people that can actually give you a prefilled medication or prepare medication and give you. There are special people that can do that, not everyone, so that nobody will put you into trouble. All right? Somebody can give you diazepam 5 10 mg and tell you it's 5 mg and you just pum without even looking at it. So don't mix your get your medication yourself. All right? So these are the people that can actually prefill. Pharmacy technicians who prefill syringes, they are certified to do that. Nurses or medical assistants preparing a syringe for a physician. Mind you, not preparing a syringe for another nurse. Preparing a syringe for a physician. Very different things altogether. And also healthcare workers teaching a patient to administer his or her own medication. All right. And when you are injecting someone, you understand, you must choose the appropriate needle. You must choose the appropriate needle. All right. You can't use a needle for IM to give SubQ. It does not make any rational sense. So that you don't injure someone. And when you are choosing these diameters of needle, when you are choosing a certain needle, you consider the gauge and you consider what? The length. The gauge is the interior diameter. The smaller the gauge corresponds to larger diameter. Smaller gauges correspond to larger diameter. It's inverse proportionality. If you know what inverse proportion is, it's inverse proportion. All right. So if you see a gauge that it's maybe like 20 cm and another one that maybe like 22, you see that the one that 20 has wider diameter than the one that is what? 22. All right. So if you look at this diagram, you'll be able to see what we are talking about. You understand? So this is for intradermal, use 25 to 26. For subcute, use 23 to 27. Subcute, right? Then for intramuscular, use 22 to 25. For children, infants. For adults, 21 to 25. All right? Very important. So this is something that they can give you in the exam and tell it which part is this, which part is this. All right? So briefly, who can tell me the part that is B? Type it in the comment section quickly. Before we even start, let me just see if you can remember. Let me see. Okay. So, guys, the rules and the regulation for this discourse is that everybody must comment. We have 42 people here, so I'm expecting 42 comments. If you don't know it, just say not sure, or just make an attempt. If you can get it wrong, you can actually call this B needle. No problem. Nobody will beat you up. But at least at the end of the day, you know that it is not what needle. All right. So what you need to do is to make sure you understand the different parts, because they will give you. That's why I just asked it now. All right. So if you go back, you see it. Like I can see that somebody says it's what plunger. Somebody sees this green one is the plunger. That's what I want to show you right now. This green one here is the plunger. All right. Why this one on top of the green one more transparent? All right. For people that has terrible eyesight like me, you'll be seeing it as white. So if you are seeing this thing as white, your eyes is bad like mine. So this is what the barrel. Please, this is the trailing ring. This is the leading ring. I know why I'm saying it again. Okay. I know why I had to go back to look at it. Somebody's laughing at me. Somebody say this voice crazy. Okay, guys. So you practice. So these are drops, these are sprays, all right, to deliver medication to the nose and throat and all those things, all right. Now we have inhalants, we have a nebulizer, which inhalants, you understand, which we give through using nebulizer or meter dose. That's MDIs, all right. This is for meter dose. You look at it. Truly, the truth of the matter is that there is always an instruction by the manufacturer. Always. Same thing with nebulizers. There will be instruction by the manufacturer. Then other medication administration forms and equipment. You talk about the vaginal medications. Talk about the rectal medications like Dowchin suppository. All right. This we use for vaginal medications. Then rectal medications we use enema suppositories. So you look this up, in case of if they ask you. Now these are for topicals, gels, creams, ointments, paste, and others. These are transdermals like patches. The one we usually use for people that don't want babies and others. So that's that for this topic. I want to start my question. The topic is very boring. Sorry. Or maybe I'm the one that is boring today. Okay, guys. So are you ready? The rules and regulation is that everybody has to pick an answer. All right. And you have to do it very fast. Immediately I put it pew, pew, so that we can go fast. Once we are done with this, we can move to the next chapter. Very fast, guys. Very fast, please. Okay. So let's go. Somebody is shouting already. Okay. Oh, this question looks like one of the questions we treated last time. But so I believe it will be very easy. Testing the mic. Let's test the microphone. Testing the microphone, guys. When measuring oral liquid medication, which of the following equals 1 TBSP? 1 tablespoon is what? 5 ml, 10 ml, 15 ml, 30 ml. I'm feeling this. Everybody is very active and gingered. Keep going, keep going. Perfect, perfect. I love this. I hope everybody here knows, everybody here is well aware that 1 tablespoon is equals to 15 ml. You must know it. My mic is not working. Why? Can't you hear me? I'm seeing the volume stuff moving. It is. Please, please don't scare me. Because last some days ago that I did live, suddenly the mic stopped working and I had to reboot the entire thing, start giving people new link and all those things. I don't want that problem today. Okay, so everybody here has to know that 15 milliliters is equals to 1 tablespoon. You have to know that. Okay, let's go to the next question. To the next question. Still testing the microphone. Okay, that was what you were talking about. The microphone is not working. Okay. I get the joke now. My brain is working very slow this night. An oral medication comes in a bottle labeled 5 units per milliliter. The dose to be administered in 20 units. Which of the following is the correct dose? I'm not giving option. No. I know some people are waiting for me to give options. I'm not. Keep going, guys. Keep going. You guys are so correct. You guys are so correct. The answer is what? 4. And I hope everybody knows how we got that answer. All right. I hope everybody does know how we got that answer. It's very straightforward. It's still testing the microphone. You don't know? Oh, the question says an oral medication comes in a bottle labeled 5 units per milliliter. So 5 units is 1. 5 units is 1. How many 5 is in 24? That's how we got the answer. Just divide 20 by 5. All right. So I believe you're understanding now. Now, why I brought this page back is because I want to post something. The next question, I don't know how to post image on this YouTube. So I'm going to create here and post this picture here. Let me see if it will work. Perfect. So look at this diagram, guys. See this diagram? This is the diagram you will see. So they will ask you a question like this. For that diagram, they will ask you a question like this. You can see the diagram, everybody. First one is A, second one is B, third one is C, fourth one is D. Look at the question here. Which of these droppers is the best choice to measure 0.1 ml of an oral medication? Which of these droppers is the best choice to measure 0.1 ml of oral medication? We are still testing the microphone. No? This is not serious question. It's very straightforward question. Exactly. The answer is B. Yes, you use that B. You use that B. Now look at this question. With you still using the same diagram, guys, still using the same diagram. Look at this question. The physician orders 5 ml of a liquid oral medication for a 2-year-old child Which of these droppers would be the best choice to measure this dosage? It's hard to see. Really? Let me see if I can make it bigger. Can you see now? You can see now, right? Yes, it's bigger now. Better. Yes, okay. Yeah, I just don't want it to cover my entire screen. That's why I'm doing it like this. Okay, good. So you guys are very correct. If you look at it very well, you see that D has a 1 TSB, right? And 1 TSB is equivalent to what? 5 ml. All right. So that the answer is what? D. You guys are very correct. Okay. This testing the microphone is interesting. Okay. For that, finally, for that particular picture. Finally, for that particular picture, yes, the answer is D. Actually, look at finally with using the same picture, guys. Which of these droppers is the best choice for measuring a dose of 34 TSP? Okay, sorry, that thing is not 34. That thing is 3/4, please. I made a mistake. It's not 34, it's 3/4. 3/4. 3/4, please. TSP. 3/4. Let's go, guys. Please, it will be nice for you to attempt the question so that any question from that you're able to understand the concept rather. Yes, answer is D. 3/4 TSP. And I said that's the last question, right? Let me just chip in this because so the same question, the same image. Look at this image. Yeah, very straightforward. Of course, your questions are always very straightforward. Don't overthink it. That's the problem a lot of people has. They overthink it. Look at this question. Dash is the best choice to measure 0.6 ml. Yes, the answer is B. Oh, this thing don't want me to paste. Why now? And I'm normally in pasting detected. Let me open another page. Shit. I'm not able to paste this particular picture, and I really need to paste it. Copy. No, the answer is not D, it's B. Okay, so what I will do is let me save it in my system then. I open it here. I'm trying to so hold on, I want to show you this picture. How do I get this picture here now? I don't know how to get this picture here. It's not working. From this device. I don't know how to get the picture, so I'm going to avoid it. Honestly, like I'm trying to put in this picture. There's a picture I need to put in, and I want you guys to see it. But it didn't work the way I did the other magic. It did not work. So I don't know. And I normally am pasting. So it didn't work. And I don't know how else to show you the diagram. Maybe use comment. No, if I put it in comment section, picture does not show in comment section. Picture doesn't show. That's the problem. Let me see if maybe I can use notes. What was it? It's actually no, it defeats the purpose now. I wanted to. Can I put a picture on a notepad? Let me see. If I can put picture on a notepad, then I will do it on a notepad. But notepad is for notes. No, I cannot. Try. Copy and paste. What do you think I have been doing since? It's copy and paste now. Anyway, let me leave it. Maybe before the end of the discourse. And there are almost four questions there. Maybe before the end of the discourse, I will see a way to do it. All right. Maybe before the end of the discourse. So I want you to try this question. Which of the following syringes should be used to measure? Look at this question, guys. Which of the following syringes should be used to measure 60 units of insulin? I'll give you options. A, standard syringe. Let me give you the options. Someone is laughing at me. Someone said, Professor, you're not tech savvy. I am very tech savvy, honestly. It's just that I'm learning to use this YouTube for, for now. This is B. This is C. And this is D. What was the answer, guys? Everybody, what was the answer? Which of the following syringes should be used to measure 60 units of insulin? Standard syringe, tuberculin syringe, U100 50 units capacity syringe, U100 100 units capacity syringe, guys. Let's go, guys. Use the picture in D. I don't know what you're saying. Okay, maybe another thing I can do is to open I can open PowerPoint. Let me try. Or even Microsoft Word. What am I even thinking? I can easily have opened Microsoft Word and use Microsoft Word. Yes, that's what I'm going to do. Why didn't I think of that? Nobody even told me, Seth. I can't see the options, but I can see you at the PowerPoint. Yeah, of course. We are trying to see if there is any way we can. Hold on. The options, you just scroll up so that you can see the options. Scroll up. If you need the options, scroll up so that you can see the options. I've already posted it there. Hold on, I'm trying to find a way to put this image. Trying to find a way to put this image because you guys need it. There are a lot of images today. There is a whole lot of images. And if I'm able to get a way to show you guys these images, I'll be a happy man. And yes, the answer to that question is D. U100 and U100 units capacity insulin syringe. That's the answer. All right. Because 60 units is above like C. Some people choose C. C is U100 50 units capacity. All right. So they gave you above 50 units. You don't inject, then bring another 10 to inject. No, we don't want to do that. So you take the one that will, contain the entire medication that you want to give. Hold on, let me see if copy image, and paste. Yes, it works. Okay, let me share the image now. It worked. You guys are not happy for me. I'm doing a lot of things. This is what I wanted to show you. I am so happy that it worked. Why didn't I think of this thing before? You should be helping me to think of these kind of things. So this is the image, guys. This is the image. You want me to zoom it? I can gladly zoom it for you. This is the image. Oh, you said you should thank me. Why? Why am I now? See, why am I thanking you? Did you say anything about that? If you did, I didn't know. Sorry, but thank you anyway. Okay, so now let's answer this question, guys. With this image, answer this question. Mr. Whatever is to take 1 OZ of an oral medication. Which device would be used to measure this dose? You see how what you learned before, you have to apply it here in terms of conversion. So the first one is 1, 2, 3, 4. Okay, which one? Keep going, guys. Keep going. Some people are thinking, they're trying to understand why. If you look at it, oh, because they did not put the units that you're aware of, that's OZ, that's pounds. They didn't put it. If you check this thing now, you have to convert that OZ. All right, that ounces, you have to convert it to ml. That's what they are telling you. Then you know which dosage to use. And all of you are very correct. The answer is 1. So for some people that do not understand what we are doing, if you look at it now, that's number 1. That it shows a cup, right? Despite the fact that the calibration is not in ounces, right? 1 ounce is equivalent to 30 ml. 1 ounce is equivalent to 30 ml. So for you to just fill the cup and give the medication. So that's why you need to know how to convert. All right, for you to be able to answer these questions properly. If you don't know how to convert, start learning it now. All right, look at this question using the same image. Look at this question. Look at this question, guys. Using this same image, an oral medication comes in a bottle labeled 5 milligram per milliliter. The dose to be administered is 20 mg. Which device would be the best choice to measure this dose? I'm reading it out so that some people that have to come back to this will be able to, if they don't see the charts, they'll be able to understand what I'm asking. An oral medication comes in a bottle labeled 5 mg per milliliter. The dose to be administered is 20 mg. Which device would be the best choice to measure this dose? Somebody said 1, somebody said 2. Keep going, guys. Yes, I need to see it. Somebody say 1, somebody say 2. Keep going. Keep going. Yes, the answer is 2, guys. The answer is 2. At the end of the day, these doses will require like an oral medication comes in a bottle about 5 milligram per milliliter. The dose to be administered is 20. So what you need is 4 ml of medication. All right. So if you check it, that 2 is the one that is closest to 4. I can't see the picture. Why can't you see the picture? I thought I am sharing my the background. Are you the only one that can't see the picture, or every other person? This is the picture. You want me to expand it? Let me make it bigger. This is better? Yes. Okay. Okay. So let me give you one more question on this. One more question on this. So I gave you 3 questions on the other one, and 4 questions on the other one, and 3 questions on this. So you'll be very equipped, all right? Anyone you see, you'll be able to answer it properly. Look at this question. A 2-year-old is to receive a 1. I repeat? Yeah, a 2-year-old is to receive a 1 TSP, teaspoon dose of an oral medication, liquid medication. Which piece of equipment is the best choice to administer this to the child? Which one? Say I can't see it. I don't understand. Somebody is still saying I can't see it. But I zoomed it for you now. This is it now. This is the images here. A 2-year-old child is to receive. Okay, this is interesting. Some people say D, some people say C, some people say CD. CD. So any which way you are going to, you have to pick one. Guys, the answer is C. That's number 3. Number 3. Number 3. The calibrated spoon is the best choice, all right, to administer this dose to a child. You understand? Because when you use cup, the child can resist it. It can be very difficult. You understand? So number 3, the third one is the best to use. Yeah. Oh my God, it's C. Yeah, it's C, guys. So I'm leaving this diagram now, this particular picture. So we are running away from this picture. If there's another one, I will do the same thing. So let me remove it so that it won't lag. Trying to avoid any issue with this. I've asked you this question on insulin, yes. Oh, is this not the same thing? Let me see. Yes, it's C, guys. Let me see. This is 1 ml, 2 ml, 3 ml, 4 ml, 5 ml. Is it the same diagram with the one I showed initially? Let me see. 1 ml, 2 ml, 3 ml. To this 1 TSP, 2 TSP, 2, 1/2, 5, 30 ml. Okay, guys. So there is still 2 more questions that I was supposed to ask with that. So I will still share it again. There are 2 more questions I will have to ask. You have to follow it, because if you don't follow me, if you didn't follow any question, you can wait after the discussion. You just go back to the just write down the minutes so that you again. All right. So look at this question, this image, and I'm sharing this image again. I want to post a question for you. The last one we did was C, all right? You need to be very fast so that you can catch it. Look at this question. This is the completion of the question. Mrs. Mapo reports that she is having difficulty. She reports that she's having difficulty with her 4-year-old taking medicine from the cup provided with medication. The child may take the medication better if she uses which of these? Which one? Keep going, guys. Keep going, keep going, keep going. Yes, the answer is C. You guys are very correct. The answer is C because it's designed for such. Look at the same image. Answer this question with the same image. The physician ordered 1 over, please, that thing is 1/4, not 14. It's 1/4. The physician ordered 1/4 teaspoon of medication instilled into Mr. whoever's right ear. Which device should be used to measure and administer this order? Which device? Yes, you guys are very correct. No, it's not 2, it's 4. All right, that's D. You guys are very correct. You say how many? I don't know. Maybe 100 or so, or 70. 100 or 75. I don't know. For people in my class, probably. None of this makes sense if it's 70 ml. No, 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 no. The thing is that if you check the question very well. They are talking about the ear, right? That question is talking about the ear. You understand? And which one will you use to measure the ear? Will you put cup? Will you pour cup inside the ear? So that's why we are using that number 3. All right. Or that's why we are using the number 4 rather, not number 3, number 4. To drop it inside the ear. All right. Okay, got it. Perfect. So look at this next question. A tobacco syringe is being used to administer 0.35 ml of a given medication. Which of the following is the equivalent dose? A. Let me give you the option, guys. Just hold on. Let me give you the options because you need an option for this. Look at the option A. This isn't the photo. No, 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 no. This is no longer the photo. Let me remove it. This one is no longer the photo, guys. I'm done with the photo. A. This is A. This is B. Thank you for reminding me because I forgot I'm still sharing it. This is B. This is C. So what I'm trying to do is to show you different forms where they can ask you question. You right? So I just need you to be able to know why that answer is the answer. You understand? So look at this question. A tobacco syringe is being used to administer 0.35 ml of a given medication. Which of the following is the equivalent dose? Which of the following is the equivalent dose? Let's go, guys. Let's go, guys. Is it 0.35 hundredths of a milliliter? Is it 3.5 hundredths of a milliliter? Is it 35 hundredths of a milliliter? Is it 350 hundredths of a milliliter? What's the answer, guys? Come on, what happened? Where is everybody? Some people disappeared. We are back to 35. Are they running away? They run away now. What about the others? No, the options is 0.35 hundredths of a milliliter, 3.5 hundredths of a milliliter, 35 hundredths of a milliliter, 350 hundredths of a milliliter. What's the answer? I don't know. How would you do that? A tubercular syringe is being used to administer 0.35 ml of a given medication, which is the equivalent dose. If you look at it, 0.35 ml is 35 hundredths of a milliliter. It's just like, if you know your conversion very well, you see that it's the same thing as 35 hundredths, right? 0.35 tenths, hundredths. So the answer is C, guys. Somebody's saying 3.5. No, the answer is 35, not 3.5. It's 35 hundredths. All right. Yes, the answer is C. So I need you guys to give me this thing very fast. I want us to hurry. Very, very fast. Please. What's the answer to this? Quickly. Which of the following can be used to administer 9 ml? A is standard syringe. Which of the following can be used to administer a 9 ml dose via the IV route? A, standard syringe. B, insulin syringe. C, tuberculin syringe. And D, large capacity syringe. Which of the following can be used to administer a 9 ml dose via the IV route? A, standard syringe. B, insulin syringe. D, AC, tuberculin syringe. And D, large capacity syringe. Let's go, guys. Let's go. Thank you. You guys are very correct. It's large capacity. You see how surface these questions are? Very, very surface. Look at this question. Which of the following is best used to measure a 3 ml of oral medication? I'll give you the option. Which of the following is best used to measure 3 ml of oral medication? A medicine cup. B, a standard syringe. C, an oral syringe. D, a metered dose inhaler. Very fast, guys. Very fast. 3 ml. Very fast. A, medicine cup. B, standard syringe. C, oral syringe. D, a metered dose inhaler. Okay, to save our time, the answer is the oral syringe, guys. It's oral. Just put it in your head. 3 ml oral syringe. Put it in your head, please. It says I should repeat the options. Later, watch the video, please. We have a lot of things to go. So you have to pay attention. I'll read the options just once. Which of the following might contain a powdered form of a medication? Which of the, yes, oral is correct. Which of the following might contain a powdered form of the medication? A, ampoule. B, vial. C, cartridge. D, prefilled syringe. Which of the following might contain a powdered form of medication? A, ampoule. B, vial. C, cartridge. D, prefilled syringe. Keep going, guys. We need to hurry up because, you know. Yes. No, somebody said cartridge. No, it's not cartridge. The answer is what? Vial. Please. The answer is vial. You're correct. You guys are correct. Look at this question. Which of the following is the best for measuring and administering a... Okay. I see why I'm stretching my eyes, because this laptop is dim. Let there be lights. It's now bright. So happy. Okay. Hey. I was wondering why I'm stretching since. A standard syringe is best. Did I answer my own question? Which of the following is best for measuring and administering a parenteral dose of 2 ml. A, medicine cup. B, an oral syringe. C, a standard syringe. D, a tuberculin syringe. Answer. Which of the following is best for measuring and administering a parenteral dose of 2 ml? A, medicine cup. B, an oral syringe. C, a standard syringe. D, a tuberculin syringe. Come on, guys. Come on. Where is everybody? Exactly. I need to see it to walk too fast. Please, the answer to that question is standard, all right? It's standard syringe. It's standard. Look at this question, guys. You have to go with me very fast so that we can, jump into something else. Which of the following is best used to give 1 tablespoon to a baby? A, dropper. B, oral syringe. C, standard syringe. D, medicine cup. A, dropper. B, oral syringe. C, standard syringe. D, medicine cup. Which of the following is best used to give 1 teaspoon to a baby? A, dropper. B, oral syringe. C, standard syringe. D, medicine cup. Why is it that it seems that when one person says something, everybody follows? Please, the answer to that thing is oral syringe, guys. To a baby, oral syringe. That's the answer. Just know it. Which of the following is best to give 1 tablespoon to a baby? Dropper, oral syringe, standard syringe, medicine cup. The answer is oral syringe, guys. Which of the following would be the best to give 5 minutes? Which of the following would be the best to give? Somebody say how. It's in the slide. Hey God, the problem is why not dropper? Because dropper is usually for ear and eye. If you check the distance, then in some instances we can use it for babies. But when they are talking about babies specifically, if they give you a question and they are telling you 1 TSP to a baby, it's most definitely oral syringe. Don't put dropper. If they tell you, oh, they want to put something in the baby's eyes or in the baby's ear, or even an adult, please use dropper. All right? Please. Which of the following the most normal baby? Look at the question. Which of the following would be the best to give 5 ml to an elderly person who has difficulty swallowing? A cup. B, calibrated spoon. C, a large capacity syringe. D, a dropper. Yeah, got it. Yes, please. Which of the following would be the best to give 5 ml to an elderly person who has difficulty swallowing? A cup. B, a calibrated spoon. C, a large capacity syringe. D, a dropper. Got it, yeah. Yeah, so when they are talking about please just use dropper. Okay. Yes, you guys are very correct. The answer is B, a calibrated spoon. Very, very correct. You guys are killing it. Measure 1. Okay. Look at this question. Look at this question, guys. Very fast. Which of the following would be the best to measure and administer 0.08 ml of medication intradermally? Which of the following would be the best to measure and administer 0.08 ml of medication intradermally? ID. A standard syringe, tuberculin syringe, insulin syringe, large capacity syringe. Let's go, guys. Let's go. Let's go. Yes, the answer is tuberculin syringe. You guys are very correct. So I want to post this now. I don't know if you can see it very well, but I will zoom it in. I hope you guys can see this one very well, right? So I will ask my question. Look at this question. What type of syringe is number 4? Quickly, guys. Number 4 is what? Number 4 is what, guys? Let's go. Let's go. What type of syringe is number 4? If you don't know it, write not sure instead of not writing anything. Yes, because when you write not sure, your brain is registering that, oh, I don't know this thing. Okay, I have to know it. But if you don't write anything, it will not make an impression on your brain. So the options is standard syringe, tuberculin syringe, insulin syringe, large capacity syringe. Okay, you guys are so correct. The answer is standard, not large capacity. The answer is standard syringe, guys. The answer is standard syringe. Standard syringe. Look at this question. What is number 3? What is number 3? Identify the syringe depicted by number 3. We have the is it the standard syringe, the tuberculin syringe, the insulin syringe, the large capacity? The same option, large capacity. Number 3 is what? Where is everybody? We are up to 40 here. Come on, guys. You guys should talk. Number 3 is what? Yes, you are extremely correct. Number 3 is what? Tuberculin syringe. You guys are so correct. So correct. Okay, let me try you guys now with this. Which of these syringe would be used to administer 10 units of NPH insulin? Which of these syringe? Somebody said oral. No, that answer. I guess you're answering the other number 3. Number 3 is not oral. Number 3 is TB, tubercular syringe. So which of these will be used to administer 10 units of? They are just indirectly asking which one is insulin. Okay, you guys are so correct. The answer is 1. The answer is 1. Very correct. Now look at this question. Which of these syringes will be used to measure and administer 6.8 ml of a medication? 6.8 ml of a medication. Which of them? Yeah, you guys are so correct. The answer is 2, large capacity. That number 2 is large capacity. Okay, so that is that for that diagram. So we need now so that it won't affect. Look at this question. Guys, look at this question. I'm not giving you options, please. The physician has ordered medication to be instilled into the nasal cavity. Which of the following pieces of equipment would be best to use? I'm not giving you option. No. We are done with that image. Yes, you're correct. Number 2, of course, large capacity. But this one is saying the physician has ordered medication to be instilled into the nasal cavity. Which of the following pieces of equipment would be best to use? Medicine cup, medicine dropper, tuberculin syringe, teaspoon. Yes, the answer is dropper. That was what I was trying to tell you guys before. Once you just hear eyes, nose, ear, dropper, think of dropper. All right. So look at this image now. I don't know if it's too clear. I hope I didn't zoom it too much. Look at this image. All right. Look at it. I'm asking you a question. Yes. I'm asking you this question from this image. Please look at this image first. Tell me, everybody, number one is what? Number one is what? Very fast, very fast, very fast. I need us to finish this thing and just jump out here. Perfect. Number one is plunger. Oh yeah, everybody, answer this one. The leading ring represented by which number? Which number is the leading ring? If everybody's answering, you should answer to make sure you know what we are talking about. Yes, that's number 4. Okay, look at this question. What is represented by the number 5? What's number 5, guys? Okay, yes, you guys are so correct. That is the hub. Very correct. That's the hub. Yes, very correct. What was the answer to this? Yes, that's the hub. You're right. What's the answer? What number on this figure represent the trailing ring? Exactly. You guys are so correct. That's number 3. Okay. Look at this. I know you guys like this. I think you guys prefer this picture question. It's more direct, more straightforward. Eh? Look at this, guys. I hope this thing is clear enough. Yes. I hope this is clear enough. Eh? So let me give you 2 questions on it. What is the dosage in this ring? We have 2 mils, we have 2.5, we have 2.2, we have 2.7. What is the dosage in this ring in this syringe. We have 2 mils, we have 2.5, we have 2.2, we have 2.7. Yes, you guys are so correct. The answer is 2.2. It can look like 2.1, which is exactly why 2.1 is not in the option. All right, so that's a win-win for everybody. So even if you say 2.1, you are still correct, because it looks like 2.1 in my eyes, but 2.1 is not in the option, and so the closest thing is what? 2.2, but it's not 2. Okay, so what type of syringe is this, guys? What type of syringe is this? I'm asking just 5 more questions, or maybe 4 or 3 more questions, and we are done with this. All right, don't worry, the others are very, very short, so you don't need to worry. This one is a little more confusing. That's why I'm taking my time here. Yes, you guys are very correct. That's standard. That's standard syringe. That's standard syringe. Look at this question. Which of the following is placed through the skin into the stomach to deliver medications and nutrients directly into the stomach? We have a nasogastric tube. We have nasal small bowel tube. We have jejunostomy tube. We have PEG tube. These questions I'm asking is just from this chapter. Okay, you're asking most. I don't know. My own is to make sure that you catch the chapter in any direction the question is coming out from. That's just understand each of these questions, so that if you see something similar, you can catch it. Any direction it's coming out from. The most important, this is last minute review, is to equip you, all right? To make you have confidence so that you don't go to the exam with anxiety. That's the idea. Which of the following is placed through the skin into the stomach to deliver medications and nutrients directly into the stomach? A, nasogastric tube, nasal small bowel tube, jejunostomy, PEG. Yes, the answer is D, PEG, guys. The answer is D, PEG. What's the maximum amount of medication given subcutaneous patient 12 months of age? Please, the answer is PEG. So, no, it's not A, it's D. So go look it up. What is the maximum amount of medication that can be given subcutaneously to a patient over 12 months of age? I said 4 questions, so this is 5 questions. So this is 1. My bad. No, it's okay. It's fine. What is the maximum amount of medication that can be given subcutaneously to a patient over 12 months of age? 0.5 mil, 1 mil, 2 mil, 3 mil. Answer, guys. Keep going, keep going, keep going. We have 3 more questions and we'll run away from here. Yes, you guys are very correct. That's 1 mil. 1 mil is the maximum, guys. 1 mil. If you don't know it now, know it now. I'm what? Am I lagging? Oh, let me remove it. If you don't know it now. A prescription indicates the patient should receive Phenergan. A prescription indicates that the patient should receive Phenergan 12.5 mg PR for nausea and vomiting. By what route should this medication be administered? Oh, I didn't pose the question. By what route should this medication be administered? A, topically, B, through the rectum, C, through the vagina, D, transdermally. A, topically, B, through the rectum, C, through the vagina, D, transdermally. I don't understand. This one you guys are answering, picking option that is not in the answer that is not in the option. I'm not seeing any IV in the option. No. I said topically, through the rectum, through the vagina, transdermally. Is it because the first person said transdermally? That's why all of you are saying transdermally. How can you say transdermally when when you see? Wait, hold on. Let me look at the question and make sure I posted the exact question. It said 12.5 mg. Look at the question, guys. Everybody should scroll up and look at that question. A prescription indicates that a patient should receive Phenergan 12.5 milligram PR. PR is parectum. IV is in the vein. PR is parectum. Transdermal is still ID, intradermal. Okay, so it's through the rectum, all right? Okay, look at this question. Look at this question. Someone say, "Oh wow." Someone say, "Oh yes." I get it. I get it. Medication that is delivered through the skin to be absorbed into the bloodstream is called DASH medication. Medication that is delivered through the skin to be absorbed into the bloodstream is called DASH medication. A. Transdermal. B. Topical. C. Inhalant. D. Douch. Transdermal, topical, inhalant, douch. Please, the answer is transdermal, not topical. Despite the fact that topical and transdermal they sound the same way, but you know, most topical medications they don't really absorb into the skin, into the bloodstream. So the fact that that place mentioned absorbed into the bloodstream is because it's trying to differentiate that transdermal from topical. So please, the answer is topical. It's transdermal, all right, not topical, transdermal. So the idea of transdermal is for a medication to be applied to the skin for it to be absorbed directly into the bloodstream. All right. So you need to differentiate it. The answer is transdermal. So I have two more questions, right? So this, then the last one. Look at this question. Oh, it's more than. Look at this question, guys. So the question says, you you are asked to apply a transdermal pain pouch to a patient who had surgery a few hours ago. Using a waterproof pen, you write the required information on the patch. Which of the following items does not necessarily have to be written on the patch? A, your initials. Please pay attention for the option. A, your initials. B, the date you applied the patch. C, the time you applied the patch. And D, the prescriber's name. A, your initials or signature. B, the date you applied the pouch. C, the time you applied the patch. And D, the prescriber's name. Answer. Yeah, take care. Yes, the prescriber's name, very, very important. That's the one you don't necessarily need to write, all right? So the final question I want to ask you guys for here is this. Liquid medication delivered through the vagina is administered in the form of what? A, suppository, puff, douche, patch. Yes, you guys are so correct. The answer is douching. The answer is douche. All right. I don't know. Somebody says douche. A student was teaching me how to make this pronunciation. You know, my pronunciation is terrible. And please forgive me. All right. I'm core Nigerian. Pardon me. Okay. So, guys, I'm taking just 5 minutes to talk about this slide. Then I jump into the question. So you have to pay attention. Right? I'm not taking any question from it. Like I'm not taking any question from you on this. All right. I'll give you my question immediately so that we don't waste time. All right. So this one is talking about interpreting medications. Interpreting. What you need to know is the prescriber's name, EMR, frequency, MAR, medication order, prescription routes. All right. These are the normal terms. It's very, very fast. All right. It's because it's important for you to be able to read and understand the medication. Extremely important. AP is the authorized prescriber. All right. Authorized prescriber, that's AP. So you need to know the form, route, and frequency. These are the things that are very, very important for this particular chapter. You have to use approved abbreviations. Don't use just anyhow medication abbreviations, because if you use anyhow abbreviations, it can lead to error. All right. Very, very important. We use Roman numerals a lot. You understand, to represent numbers. These are the common ones, like SS, half, I1, V5, X10. All right. If any letter with a smaller value appears before a letter with a larger value, subtract the smaller value from the larger value. I believe all of you know how to do this because we took time to do it. Then add a value of all the letters not affected by the step 1 to those that are combined. All right. Something like this. XIV. X is larger than I. So you write the X here, that's 10. I is smaller than V. So because it's smaller than V, just minus V is 5, right? So V minus 5 will become 4. All right. So you have 10, 4. That's 14. But if this V came before I, it will be X, 10, V, 5, then I, 1. It will be 16. All right. Instead of 14. So that's just what they're telling you. You do the same thing here and you get your answer. These are the essential components of medication order: full name of the patient, date of birth, date the order it was written, date of birth, and full medication, full name of medication. These are the routes, all right, and the hour to identify. Now, this frequency of order, extremely important, all right. Daily, if they write daily, they have to write the time. Oh, when do you want this drug to be administered? If they don't write it, ask. Please ask. Always ask. Don't be shy to ask. All right. Don't think they will see you as you don't know something. Nobody will ever see you like that. And don't think maybe they will chase you out of the clinic. You lose your job because you asked a question. It's not true. It can never happen. I've never seen anybody in medicals losing a job because he wasn't able to get something, or because he asked the question. Nah, nobody does that. Instead, they will chase you away if instead of you to ask question, you went to do the wrong thing. That's where you have a problem. All right. So Q12 hours. Okay, some colleagues are insulting when you ask questions. I don't know what you're talking about. All right. Okay, you say some of your colleagues are insult. No, listen. Oh, that's what you mean. Listen. Ask questions. Take the insults than making a mistake. The highest thing anybody can do to you is, oh, this person doesn't even know this simple thing. That's the highest thing. No, I'm serious. Even when I finished medical school initially, I was in the hospital. I don't even know how to set line properly. Because one of the things about medicine is that they don't start teaching you about certain lines. They believe you learn it along the way. All those little things. Nobody teaches you that. So I don't know how to set the line, and I was not like I don't know, but I've not been doing it, so I don't have that confidence. I told the nurse, and she was, the way she looked at me. Instead of me to get angry, I started laughing. I laugh too much. I said, please come and teach me something. Fine, I don't know it. Teach me. You know it better than me. I played with it, and me and that nurse became very good friends after later on. You understand? So it depends on how you handle it. If you start getting angry, you understand, because of that, that's when you have a problem. Trust me. You understand? It will always happen. So even if they shrug the shoulder or they start acting rudely, just please, I don't know it. Just teach me. And you'll be good to go. Don't hide in ignorance. All right? Just laugh. They can't do anything. They can't beat you. So these are the things that are very important in electronic medication order. We have the patient's name, medication dose, medication route, frequency, and amount. Extremely important that you know these things, all right? You have to be able to match this, and I'm not doing it right now. Okay, so this prescription and medication order. Prescriptions are outpatients. Medication is inpatients, all right? Prescriptions may be written on the pad by, may be called in to pharmacists. It can be called, hey, pharmacy, please, so-and-so patient is coming. Please, can you give so-and-so medication? Straight to the pharmacist, all right? They may be electronically written and communicated. Depends on the circumstance, but it has to be by the authorized prescriber. So this prescription must contain 8 components. These are the components that I'm not going to talk about right now. All right. So I hope you guys have read this thing. All right. These are the other components. Are these orders correct? This is the kind of question they will give you, and I'll show you right now. These are MARs, that's medication administration records. All right. They are legal documents, handwritten or electronic, contains same information as medication order form, specify times to administer medications, and provide what? Space to document medication administration. You have to document. If there's a reaction, you document. If there's a complaint, you document. Very, very important. What does it contain? Full name of medication, dose, date, frequency, time. All right? So that you accurately reflect frequency. Also, full name and date of birth, all right, of that patient. The date was written, and other specific instructions, depending on which instruction you want to give. This is an example of EMAR, all right? Now, these are things that you have to practice. What is missing or what is not missing, and that is it. So, see how fast we went? I believe you guys understand it. If you don't understand it, you will understand it when I ask question, all right? So, I will give you a question. I don't know if this is lagging. No, it's not. So, incoming. This stuff is very, very interesting. Interpreting medication orders. Let's see. So it's very small, which is a nice thing. Look at this question, guys. Very fast. So this is just testing the microphone. Yeah, just always in the clinic, the best thing for you to do in the clinic is keep laughing. That's the way to defeat any enemy. I call it enemy sometimes. Just keep laughing. I'm telling you, it works for me. It works for me a lot. It helps me to avoid trouble. It helps me to avoid things. They'll be like, no, she's always very cheerful, or he's always very cheerful. He plays with people, he talks to people, he greets people. And if there is a problem, they will exempt you. Even if you make a mistake, they will cover for you. But once you start showing that you know a lot, it becomes a problem. And they don't like it when you know a lot. So sometimes you hide yourself. Trust me. Okay, so look at this question, guys. This is just testing the microphone. The patient is ordered Restoril 15 mg per oral at bedtime. At what time should the medication be given? Testing the microphone. 0900 1200 1600 2100. Answer. 0900 1200 1600 2100. Answer 2100. Okay, you guys are very correct. Look at this question. This question, don't let it tempt you. Don't hold on. Let me remove this thing. Has to be seeing me very well. There's this question. Didn't realize options was coming. Okay, look at this question, guys. No, I understand. Don't worry. You are correct. It's a giveaway. It's just testing the microphone. A patient is ordered Rosteril 1 capsule per oral at bedtime. What strength capsule should be dispensed? A, 5 milligram. B, 1 capsule. C, 15 milligram. D, no strength is given. What is the answer? A patient is ordered Rosteril 1 capsule per oral at bedtime. What strength capsule should be dispensed? A, 5 milligram. B, 1 capsule. C, 15 milligram. D, no strength is given. Yes, the answer is D. The answer is D. There was no strength I was given. No, please. Please. So you have to be careful whenever you pick. Yes, no strength was given. You have to be careful so that they don't confuse you. Testing the microphone. Yeah, that question is tricky. It's simple, but it's tricky. It's easy, but it's tricky. The patient is ordered Rosteril 50 milligram PO at bedtime. By what route should the patient take this medication? Guys, we have topically, we have orally, we have rectally, we have vaginally. Yes, you guys are so correct. The answer is per oral. All right. Now look at this question. Please don't allow them trick you. Don't allow them trick you. The patient is ordered Compazine 25 milligram SUPP PRQ6H PRN nausea. If the patient received the last dose at 0600, when can she receive her next dose? We're up to 50 here. Why is everybody? No, don't give me midnight. I gave you the options. Yes, you guys are so correct. The answer is 12:00 noon. Actually, that thing is noon. 12:00 is not midnight, though. It's noon. Okay, look at this question. This is very fun, eh? Look at this question. Documentation of medication. Let's see if we can speed most of this question before we clock 2 hours. Documentation of medication administration should be done. Pay attention. I'll just read the option. Right after you prepare the medication. B, right before you administer the medication. C, immediately after you administer the medication. And D, at the end of the shift. This is what you guys are seeing right now. A, right after you prepare the medication. B, right before you administer the medication. C, immediately after you administer the medication. D, at the end of the shift. At the end. More people. Look at this question, guys. Yes. You guys are very, very correct. The answer is C. Immediately after you give that medication, please document it so that you don't forget. Truth of the matter is that a lot of people are not doing it. A lot of people are not following this instruction, and because of that, they will forget. Do you know I've seen a nurse that I saw her driving back after her shift. I was on the same shift with this nurse. As I was driving away, she was driving away. She was in front. Suddenly, this nurse turned and started driving back. Later, I called her. I was like, "What's up? What was the problem? Why were you driving back?" She said, "I forgot to document." I said, "How can you forget?" Jesus Christ. Why? Because she finished giving the medication. She waited. She went to talk, discuss with friends, colleagues, cha. And at the end of the day, she forgot. So it's very dangerous. Very, very, very dangerous. So we need to be very careful. So look at this question. Medications ordered AC are to be given when? What is AC? Okay. You guys are with me. A, before meals. C, after meal. B, after meals. C, with food. D, with milk. Before, after, with food, and with milk. Anti-sebum. Yeah, you're correct. That's before meal. Yeah, you guys are correct. AC is before meal, all right? Look at this question. 24 correctly written as a Roman numeral is dash. 24 is what? XXIII, XIXV, XXIV, XSIII. I believe everybody should write this one. Everybody should be able to write this one. Come on, guys. We are up to 45 here now. Why is just 7 people writing? Yes, the answer is XXIV. You guys are so hot this night. Oh yeah, give me the answer to this. VISS minus ISS is equals to what? Yes, that answer is XSIV. You're correct. So look at this one. VIXS SS minus ISS. I'm reading it out so that the people that are going to watch it will know what we're talking about. VI. S for serpent. S for serpent. Minus I. S for serpent. S for serpent. Not sure. Okay, that's fair. That's fair. Let's go. Oh, thank you very much for writing it for us. VISS is 6.5. Yes. So 6.5 is just like 6.5 minus what? Minus ISS. What is ISS, guys? ISS is 1.5. That's 5. The answer is 5. No, it's not 6.5 minus half. Half is SS. This is ISS. That's 1.5. The answer is not. What did you write? If you write 6.5 minus half, what you will be getting will be 6. But the answer is not 6. The answer is 5. It's V. All right. And funny enough, 6 is in the option, so be careful so that they don't catch you because they want to catch you. Wow. Let's see. Let's see, guys. I remember somebody telling me, Professor, that one you gave is too long. No. Okay, look at this. X, 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 V, I, S, serpent S, and another serpent S, converted to an Arabic number is dash. X, 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 V, I, serpent S. What is it, guys? If you want to write it in, what is it? Some people are still calculating it. That's good. If you want to calculate it, the XXX is 30 already. So write 30 down. The next one is V. You write, that's 35. Then I, that's 3. That's 38. Then SS, half. 38 and half. Eh? I believe you are able to get it. So look at this question. Yes, it's 38 and half. Look at this question. This is the question, electronic MARS. Eh? I'll give you option. It's option A, incoming. Option A, do not include medication records. Option B, option C, option D, what's the answer? Electronic MARs do not include medication records. A, include medication orders and administrations. B, are not used for physician orders or documentation of medication administration. C, do not require a login or secure password. D, what's the answer? A, B, C, D, E, F, G, I, J, K, L, M, N, N. Say M, M, M. Yes, you guys are very correct. The answer is B. All right, yeah, extremely correct. I'm being very fast now. Yes. So look at this question. The order reads Lopressor 100 milligram MGP OTID. You have on hand 50 mg tablets. How many milligrams will the patient receive in one day? Okay, let me give you options. A, 150 mg, B, 300 mg, C, 200 mg, D, 100 mg. Don't overthink these questions, guys. It's very direct. It's superficial. Trust me, it's not deep. 150 mg, 300 mg, 200 mg, 100 mg. So if you say 300 mg, you are very correct. Somebody will ask me how. Why? Because the patient needs to take how many tablets? 2 tablets, right? And 2 tablets is 100 milligrams. They told you 1 tablet is 50 milligrams. So 2 tablets is 100 milligrams. How many times? TID is 3 times. So 100 times 3 is 300. Check it out. Don't overthink it. The problem is that most of you are overthinking the question. Most of you are overthinking it. Don't overthink it, please. Look at this question, guys. Which of the following is correctly written? Please pay very. You see, this correctly written is the question that they used to choke students. Trust me, everything we've been doing is direct, it's straightforward, but this is what they want to use to choke you. So let me see if you allow them choke you. This is A. This is B. This is C. This is D. So which of the following is correctly written order? A, ASA GR space V space Q4H space PRN space pain. B, ASA space 32 space 5 mg space PO space PRN space fever. C, aspirin space 325 milligram PO Q4H PRN headache. And the last one, aspirin PO Q4H PRN toothache. Okay, so most of you are correct. The answer is C. Some people choose D. You know, if you are choosing D, they say aspirin per oral 4 times daily. All right, 4 times daily as at when needed. Toothache. What is the milligram? What's the strength that you are giving to someone? They didn't tell you the strength. So automatically, that's not even correct. So the answer is C. All right. C is very correct. So you need to know what is missing. Look at this question. Tetracycline PO Q6H for 10 days. What is missing from this order, guys? What is missing? No option. Let's go. Let's go. Let's go. Let's go. Let's go. Frequency, route, drug, dose. You guys are so correct. It's dose, all right? Please. You guys are so correct. See this question. This question will tempt a lot of people. Let me show you. Which of the following is not included on an MAR? Which is not included? This is A. Yes, you're correct. This is B. This is C. And this is D. Which one is not included? Perfect. Okay, so time for this. Watch. I'm going to share my screen. Yes, you guys are correct, guys. You're very correct. I believe you can see my screen now. Look at this, guys. I don't know if you can see this. Can you see it? Is it clear to everybody? Yes, yes. I think it's clear to everybody. Please look at that. There are two questions I need to ask you there. Look at it very well. Okay, perfect. Perfect. Look at it. What is the route for this medication? Very quick, very quick. Is it per oral? Is it IV? Is it IM? Is it ID? Is it what is it? Okay. Subcute, subcute. Continue, guys. Continue. Somebody said subcute. Somebody said IV. Continue, guys. Continue. Heparin is subcute, huh? Uh-huh. So I don't understand what you guys are saying. Look at the picture now. Are you seeing any routes? Because you know it's heparin, it's subcute. Do you see any route from the medication order you are given? That's a mistake. A lot of people, no route is given. Simple. You don't just know. That's the problem. That's the error. Don't just know. You understand? Because you may just know, oh, this thing is supposed to be given IV. But they want you to give it, the person that prescribed that medication in his head, he wants you to give it IM, and he has a reason. But he did not write it. What you need to do is to go to him. Go to him. Like it's not like a trick, actually. In the option, you will see route not included. All right. But I didn't want to call the option. I just want to know if somebody can, detect that, oh, what I'm seeing, there is no route. All right. Don't think they made a mistake by not writing a subcute there. No, they just want you to fill it because they know you know about heparin. Okay, that's good. So the answer to that is no route was not included or no route given. So that's the answer. All right. Now, still using the same diagram. He said that was a trap. Still using the same diagram. This. How many times a day will the patient receive heparin? How many times? Let's go, guys. Let's go. So 3 times. Yes, 3 times. The patient will receive the medication 3 times. That's good. Okay, look at this, guys. Let me see if I can zoom it. I believe you all can see this. So I'm going to ask you a question on this. So the next 2 or 3 questions now will be from that image. All right. First question. Referring to this electronic medication order, letter B represents what? Letter B represents what? Frequency, dose, drug, routes. B represents what? Can't see clearly. Oh, sorry. I wish I can zoom it more than this. Okay, maybe I can. Let me see. Maybe I can. Let me see. I think this is better, right? This is better, right? Yes. It's better. Yes, the answer is route. You guys are so very correct. Now look at this question. Letter A. What's letter A? Letter A on this order is what? Yeah, route is for letter C. You guys are correct. Letter A is what? Options, the same options with the last one. Drug name and dose, B, route, C, frequency, D, patient identification. You see how easy the question is? You see a question like this. Very easy. So this is a drug name and what? Dose. Drug name and dose. If you look at it properly, you see it there. All right. Okay. How about, you see, some people will even be like, what kind of cheap question is this? This question is too cheap for my level. Don't give us this kind of question. I need you to upgrade the question, right? Okay, look at this question. Letter E on this stuff represents what? What's letter E? Option: patient's DOB, AP's name, date and time of the order, drug name. Answer. Someone say no, I will never say that. Patient's DOB, AP's name, date and time of the order, drug name. Everybody, I need everybody. We have to 40 here. Everybody has to comment. Date and time. Perfect. You see, it's actually that straightforward if you understand it. Okay. Finally, for that image. Look at this question. For this electronic order, frequency is represented by what letter? I'm asking you just 5 more questions and I'm done with this. Yes, you guys are very correct. The answer is C. Look at this question, guys. The patient is ordered through bramycin 1% ophthalmic GTT, right eye QID. How much of this medication should be administered in each dose? Option: 1%, A, B, 1 drop, C, 1 teaspoon, D, 10 minims. A, 1%. Yes, you're correct. C. A, 1%. B, 1 drop. C, 1 teaspoon. D, 10 minims. I said 5 more questions, right? So the answer is 1 drop. You guys are very correct. 1 GTT. You guys are very, very correct. They asked that question to make sure you know that what we are talking about is drop. All right. So look at this question, guys. You say, what is the order? That particular question, the patient is ordered through bramycin 1% ophthalmic GTT. All right. In the right eye is QID. How much of this medication should be administered in each dose? Answer 1%, 1 drop, 1 teaspoon, 10 minutes. All right. So that's by the way. So look at this other question that I just posted. The hospital pharmacy receives a medication order for patient Jolene Smith. Date of birth 4/23/1986 for Keflex 250 milligram QID. The medication order is dated today and is signed electronically by Mrs. Smith's physician. What additional information is needed before this medication can be administered? What's missing? AP's name, patient security, social security number, number of refills, route of administration. Perfect. The answer is route of administration. Look at this question. So this is number 4, right? Look at this question, guys. I'll put the options. An authorized prescriber gives a patient a prescription for doxycycline, 100 milligram, 100 milligram. This tag, hashtag 20 dot cap 1PO BIDPC. The pharmacy will interpret this as this. Yes, the answer is route to that. So this is A. This is B. Incoming. This is B. This is C. This is D. Yes, that's A to D. An authorized prescriber gives a patient a prescription for doxycycline 100 milligram, hashtag 20 points cap 1 PO BIDPC. The pharmacy will interpret this as A. Dispense 20 capsules of doxycycline 100 milligram with patient's instruction to take 1 capsule by mouth twice a day after meal. B. Dispense 100 capsules of doxycycline 20 milligram with patient's instruction to take 2 capsules by mouth once a day after meals. C. Dispense 20 capsules of doxycycline 100 mg with patient's instruction to take 1 capsule once a day with meals. D. Dispense 100 capsules of doxycycline 20 milligram with patient instruction to take 1 capsule by mouth twice a day before meals. Answer. Come on, guys. I needed a lot of people to attempt it. I need rather a lot of people to attempt it. What am I saying? More people. Let's go. Yes, the answer is A. That is how they interpret it. All right. That's why you have to be careful when you are even writing a prescription. Extremely careful. Yes. No, the answer is A, guy. It's A, not B. All right. Look at this question. Yes, it's A. Look at this question. And this is the completion of the question. A prescription for patient Henry Dubois, DOB, date of birth 9/2/1963, specifies amoxicillin oral suspension, 125 ml, 1 teaspoon per oral with 1 refill. The prescription is dated today and is signed by an authorized prescriber. What additional information is needed before the medication can be administered? A, quantity, B, drug name, C, frequency, D, route of administration. Yes, it is frequency. Yes, exactly. For how long? Of course, it's frequency. So look at this question very fast. A medication order for a patient, Virginia Baxter, DOB 1207, 1998. Reads, yes, frequency. Reads Motrin 200 mg PO PRN Q4H back pain. The medication order is dated today and is signed electronically by Mrs. Baxter's physician. What additional information is needed before the medication can be administered? A, quantity. B, frequency. C, route of administration. D, none. The information is complete. Yes, the answer is D. The information is very complete. All right. So look at this question. Look at this question very fast, please. Look at this question. The question says, this image. The question says, what necessary information is missing from the prescription? If you need option, dose, frequency, route of administration, none. The information is complete. Answer. Yes, that's other question. The answer is none. Yeah, you're correct. Everything was complete there. So what necessary information is missing from this prescription, this particular one I posted? Dose, frequency, route of administration, none. The information is complete. You guys are so correct. The answer is dose. The answer is dose. The same picture. The same picture. Let me see. The same picture. What is the name of the medication indicated in this prescription? You see how easy it is? Some people will tell me that the name is Anpechin. Don't mind me, I'm cracking myself up. Hey, God. Yes, you are so correct. You are so correct. Look at this. What's the answer to this? If the patient gets all of the permitted refills, how many tablets will be dispensed to get all together? The same question. Hurry up, hurry up. I'm asking the last picture now. And this last picture has 3 questions of, and that will be it. That will be all. I'm not giving you another picture for this. Somebody said I should repeat. What am I repeating? If the patient gets out all of the permitted refills, how many tablets will be dispensed altogether? Why are you guys? No, now it can't be 450. It can't be 450. Yes, yes. Somebody got the answer. It's 540. Thank you. Thank you. It's 540, not 450, bro. I say, bro. Hey, God. So please, it's 450 plus 90. Remember, the patient is taking the particular prescription. That's 90, right? Tablets. Then the 5 refills that comes with it is 90 plus 450. That's 540. Please don't let them confuse you. Don't let them confuse you. Please. Oh, yes. Okay. So, guys, I'll give you the last picture, and for this particular stuff, look at this diagram. Don't know if this is bold enough, I guess. I guess this is bold enough for all of you, right? I believe. Yes. Okay. I'll ask you questions from this particular image. You say, oh my goodness, why? Okay, because of that question, it's 540 plus 90. Jane Doe was given Tylenol for fever at 8 a.m. At noon, her temperature was 39.2 degrees centigrade. What action should be taken at noon? Okay, let me give you options. All right. A, B, C, D. Answer, guys. What action? A, administer 1/2 325 milligram Tylenol tablet. Administer 1 325 mg Tylenol tablet. Administer 2 325 mg Tylenol tablet. Do not administer Tylenol. Her temperature is below 101 degrees Fahrenheit. Yes, you guys are so correct. The answer is C. Administered, because if you look at the medication, first of all, if you convert the degrees 39.2 degrees centigrade, you guys know how to calculate it now. It's 102.6 degree Fahrenheit. All right. Now, if you calculate it that way, all right, that means the person is already having high temperature. All right, greater than 101 degree Fahrenheit. So they said give 325 milligram tab. How many of the tab? 2 tabs. So you understand? So that's C. That's why C is the answer. All right. So I believe you know why we chose that. Look at this. What necessary information is missing from these tablets? Dose, frequency, route of administration, none of the above. None. The information is complete. What was the answer? Hurry. I want to be done with this. Exactly. Let me not wait for everybody. Exactly. The answer is that the information is complete. Everything is normal. All right. Look at this. How often can the patient be given the Tylenol, assuming her, yes, none. How often can the patient be given Tylenol, assuming her fever remains above 101 degree Fahrenheit? How often? Four times a day, every 4 hours, once a day at 8 a.m., once daily, because no refills are specified. So you give it every 4 hours. That's why they put 4QH PRN every 4 hours, as far as the fever is still there. All right. Yeah, sorry. Don't worry. Later, just look at the video again. All right. Let me, so that I need to be fast. This is the last question for here. I hope you people will be able to. No, that is every 4 hours as far as the fever is there. Every 4 hours as far as the fever is there. That's what the if you look at it, they say Q4H. Every 4 hours, PRN. As far as the fever is still there, PRN fever. So look at this question. How many milligrams of Tylenol will the patient receive at each dose? Ha. No. It's not like I'm leaving. I want, because some people will soon start feeling sleepy. I want to jump to the next this thing. Trust me, I love to have you guys around. Trust me, honestly. So yes, some people say 700. It's not 700 though. They say 325. 325 times 2 is 650, not 700. And funny enough, 700 is in the option. Some people say 325. 325 is there, but it can't be 325 because you are giving 2 tablets, and 1 tablet is 325. So 2 tablets is 325 times 2, which is 650. Am I rapping? Okay. I don't think I'm rapping. Yeah. Okay. Second to the last chapter, very fast. Thank you. Thank you for the love. Thank you. So this one is talking about interpreting medication labels and packages. This one you will see pictures. In short, this your exam is more pictures than even normal questions. All right. You see a lot of pictures. These are the things you need to know: barcode, brand name, dosage strength, generic name, ID, IM, IV, monograph, and others. Package inserts, official package insert, package outsert, patient package insert, reconstitution, SubQ, trade name, transdermal, and others. All right. So it's just all about you being able to read this information. Extremely important. So if you look at this picture, you see these things point to each and every, all the information is in this stuff. All right. You need to know which is generic name and which is the brand name. Extremely important that you know that. Please, I'm trying to be fast so that you guys can sleep and rest, be well rested. Because I know by the time I'm finishing, some people are still going to go and start reading again. If you participate very well in this discussion, if you participate and you're answering questions a lot, trust me, you don't even need to read again. Because what can they give you? What is the big deal? What can they give if not this? All right. So forms of medication, we have solid medications, tablets, capsule, gel caps, and caplets. Then we have the liquid, oral, injection, inhalant, drops, sprays, and mists. Then we have others like ointment and suppositories. This dosage strength is the amount of drug per dosage unit on form of the drug. All right. Very important. The information is on the look at it. This is the dosage strength, but don't misplace the dosage strength with what? With the amount of tablets. All right. You see 30 tablets, you see 2.5, meaning that in each tablet there is 2.5 milligram of this particular medication. Extremely important. All right. They write it here. Like this one is liquid medication. You see this amount of the medication in a meal for this drug. So if they tell you to give 5 meals, it's 5 times 5, that's 25. All right. That's the strength. It's as simple as that. These are the generic names. All right. And you will see the brand names as well. This is dosage, strength. This is the total volume. In this thing now, you see 200 mils. It means that, oh, this thing, the entire is 200 mils. All right. Yeah, they can tell you to give somebody 50 mils 4 times. Then that means you use the 200 mils to break it down. Okay. So these are multiple dose, like 20 mil multiple dose vial. Some vials has multiple doses. So you need to, and when you give that dose, you need to write when you give it so that the person will know, the next person that is giving it will know, okay, is this dose still good after being exposed for so and so amount of time? Do not confuse the total amount of drug in the container with the dosage strength. Do not do that. Total amount dosage strengths. Okay. So these are routes. We have tablets, capsules, gel caps, and caplets. They can be swallowable, sublingual, or chewable. These are the liquids. All right. Yeah. Then this is you must always read the label carefully. These are warning signs. There are many types of warnings. All right. Always look for warning signs. You see it: alert, 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 911, alert. Me, if I have my own warning sign when I'm on live, that's 911. If you write 911, I know something is wrong. Quit sleeping. I smell it. The spirit tells me somebody is sleeping. Wake up. Yes, I'm talking to you. Is there no one? Yeah, I feel it. Trust me. When I tell you that somebody is sleeping, like if you're my class, if I say, who is sleeping? Trust me, somebody is sleeping. The eyes is like, you understand? So please don't sleep on me. Please, please, please. Then this is storage, all right? Your proper storage has to be ensured, and some of this medication, they will tell you where to store. Where to store, all right? Yes. The fear of this course is making everybody awake. That's good. So there's labels, all right? You need to understand what label you're looking for and what you are actually looking at. Then these are reconstitution. They will tell you how to do the reconstitution. Very, very important. Sorry, I'm flying. I really need to jump into the questions. It's for practice. It's label information related to medication routes. These oral medications. Oral medications, tablets, scored, chewable, enteric. All right. There's this information here. Tablets may be broken to give partial dose only when the tablets are scored. You see this thing? If the tablet is not scored, don't break it. Oh. Don't break it. Don't be breaking it and be telling yourself, I am sure this one is the same thing with this one. No. There are some people, I've seen somebody that broke a medication. Unfortunately, the medication was not equal. So she wants the medication to be equal. You know what she did? She started scratching the two medications. Scratching, until the bigger one got to the smaller one. Then she looked at it and she smiled at herself. Wow, I've done a great job. That's how they give people underdose. So please never crush or break enteric-coated medications. You are the one tired. Let's hurry for you, not me. You gotta ask questions. You don't know Nchebe. I can be on live till morning and I will still be in school and I will still be on time. Trust me. Okay, so see, these are the medications you should never crush or break. Enteric-coated, controlled release, extended release, sustained release. Please don't. We have capsules, all right? We have controlled release medication. Then we have liquid medication. That are liquid medications. The Nigerian way. Abi. All right. When reconstituting a drug, you must write your initials and the time and date of the reconstitution. Don't just reconstitute a drug and keep it there and write only your initials. What do I want to do with your initials? Please, when you are writing your initials, before that initial self, write the time and the date you reconstituted it. So that I don't take a drug you reconstituted last 3 weeks and come and start giving patients. No, I don't want to do that. So these are things you have to measure with. We've already discussed this, so no need. Patient education is extremely important, all right? Very, very, very important. You have to review the information. Expiry date is also very important, all right? But you need to write when you gave the dose so that the next person that is giving the dose will know how long the medication has been, all right? And to reconstitute it, to know when not to give it anymore, all right? So we have parenteral medications. We have packaged as single dose ampoules, single dose prefilled syringes, and multi-dose vials. You need to understand what we are talking about. And mind you, in their containers, the instruction is always very limited. The label is very limited. So you need to be sure of what you are doing. All right. These are different routes for parenteral, different routes. This is dosage strength. We've already discussed it. It's the amount of drug per dosage unit. We've already discussed it. These are insulin levels, origin of insulin and onset of insulin. It's written here, human insulin and others. All right. These are other routes like topical, otic, ophthalmic, rectal, vagina, inhalant, transdermal, buccal, and others. You need to understand. Everything will be written on the outside or in the insert. All right. Okay, these are for practice. These are package inserts. They provide complete authoritative information about a medication, including the description, clinical pharmacology, and indications of that medication. Also, contraindication, warning, precaution, adverse reactions, and others. Overdosage, what should you do? Dosage and administration, preparation, and manufacturer's information. So this is it. You see? No big deal. Okay. Let me remove this before some people think this is what I'm talking about. Okay. Medication. The chapter I discussed now is chapter 9, right? No, chapter 10. Chapter 10. Chapter 10. So this one, there are very few things here. Okay, let's see. Let me see how many people are still awake. Yes, just one more chapter. Yeah, we're almost done. Look at this question. I am up. Perfect. Perfect. Let's go. Perfect. Now let's test the microphone with this question. Bam. Now let me give you the options before you attempt it. Let me give you the options. So this is A. This is what did I do now? Please hold on. No. Interpretation. Hold on. Here is that question. Dispense either chewable tablets. Okay. This is B. This is C. And this is D. So I'll read it for the benefit of people that will watch this later. A prescription for a 5-year-old reads amoxicillin 1/4 of a 500 mg tablet every 8 hours for 5 days. The pharmacy stocks amoxicillin in both a chewable 125 milligram tablet and suspension. What should you do? A. Dispense either a chewable tablet or liquid form of the medication. B. Consult with the pharmacist or authorized prescriber before changing the form of the medication. C. Dispense the medication as written, instructing the parents to break the tablets into 4 pieces. Then D. Dispense the medication as written, breaking the tablets prior to dispensing them. Keep going, guys. Keep going. Where is everybody? Keep going. Are we sleeping already? I was thinking that we have like 30 people. Yes, you guys are so correct. The answer is B. Please, anytime if you are maybe you want to give a drug and there is a better form of that drug, don't just give it. Instead, go and consult with the pharmacist or the person that prescribed that medication and say, "Oh, doctor, this drug you put it as tablets, but we also have liquid here, and sometimes liquid works better for these patients. What do you think?" You understand? What do you think? The doctor will be like, "Oh, okay, let's give liquid." Don't, number one, go and use your hand and give that liquid when you've not asked. That's number one. Then number two, don't be rude, because some people, they will ask you question rudely. Somebody has done it to me before. You understand? Automatically, they just put their shoulder like this, that you don't know anything. They just want to be rude at you. You understand? Because sometimes some of these doctors, they don't even know which particular form of the medication is available at that moment. That's why nurses are the most important people in healthcare. Trust me. Trust me. Nurses are the most important. You people should look at yourself as the most important. All right? In healthcare. Why? Because you are the one that knows everything. Most times you are even the link between the pharmacist and the doctors. You know everything. If you have any information, ask a nurse and she will give you the answer. So the answer is B. Consult with the pharmacist or authorized prescriber before changing the form of what? Medication. So this is just testing the microphone, guys. Let's test the microphone again. Sustained release medications must be A, chewed, B, crushed, C, swallowed whole, D, broken in half. Sustained release medications must be A, chewed, B, crushed, C, swallowed whole, D, broken in half. Let's go, let's go, let's go. You have to type in something. Everybody must type in something. Come on, guys. I have 40 people here. Why am I getting only 10 people typing? You have to type. Yes, the answer is C. You guys are very, very correct. It must be swallowed whole. Look at this question. Medication administered buccally. Medication administered buccally. Let me give the option. Yes, swallowed whole. You are correct. Let me give the options for this. Medications administered buccally are placed A, under the tongue, B, between the tongue and the cheek, C, in the rectum, D, in the nasal cavity. Medications administered buccally are placed A, under the tongue, B, between the tongue and the cheek, C, in the rectum, D, in the nasal cavity. You guys are so correct. You guys are so correct. It's B, between the tongue and the cheek. You see how straightforward this one is? It's very easy. Very straightforward. Look at this. Very fast, guys. Medications administered transdermally are placed where? A, under the tongue, B, in the ear. Jesus Christ. C, in the eye. D, on the skin. It will shock you that somebody will pick in the eye. Trust me. And when you touch that person, the person will start defending his answer. Can you imagine the answer the person will defend? The eyes is connected to the skin. You know, look at the eyes. Look at the skin. It's somewhere around the skin. Yes, the answer is in the skin. Someone said in the limb. Yeah, funny, man. Okay. This diagram. Look at this. Look at this diagram. Look at this diagram. I'm removing this. I'll put another diagram here. Copy image. I believe everybody can see this one. This one is big enough now. So that's the diagram. And this is the question. Based on this label, amiodarone HCl. That's the question. Based on this, someone is laughing. Based on this level, amiodarone HCl, A, look at the options. Listen to the options. A, must be diluted. B, can be used for more than one patient. C, contains a preservative. D, can be given IM. Answer. Must be diluted. B, can be used for more than one patient. C, contains a preservative. D, can be given IM. What's the answer? Yes, the answer is A. This question I'm looking at, but I don't want to stress you people. Okay, see, you see how straightforward these questions are. It's pediatric, like it's baby questions, pediatric question. Look at this question. Chemical and physical description about a drug are found in which section of a package insert? A. Please pay attention for the options. Yeah, you guys are correct in the other one, right? It must be diluted. It's A. So this one, chemical and physical description about a drug are found in which section of a package insert? A. Clinical pharmacology. B. Indications and usage. C. Descriptions. D. Manufacturer supply. So if you've not subscribed, please click the subscription. Most importantly, click the notification bell. All right. That notification bell is important because sometimes I would think I've sent you guys the link and I won't. Do you understand? I'll just forget and I'll be here waiting for you guys. Also, next semester you'll be doing anatomy. I take anatomy 1 and 2. I may not be your professor, but you need to be coming here for a lot of these tutorials. All right, I discuss a lot of anatomy, so I won't be able to send you link except if you see the notifications. That's why it has to be on. Anytime I post a video, you look. Anytime I'm on live, you look. If it concerns you, fine. If it doesn't, good and fine. So this question: chemical and physical descriptions about a drug are found in which section of a package insert? A. Clinical pharmacology. B. Indications and usage. C. Description. D. Manufacturer supply. Answer is description. You guys are very correct. Not D, not manufacturer supply, but is description. So the question here is very, 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 straightforward. It's baby question. And you see a lot of baby question, but what I will fight with you is when you fail a baby question. That's where me and you will quarrel. Information about serious, possibly fatal side effects is found in the dash section of a package insert. We have adverse reactions, we have warnings, we have precautions, we have contraindications. So this kind of question is a question that if you fail after the exam, if you see, you'll be angry with yourself. You'll just be moody. If somebody even give you food, you'll be like, I don't want to eat food. The person does not know it's because you failed that question. This particular type of question. Information about a serious possible fatal side effects is found in the dash section of package insert. Adverse effects, warning, precaution, contraindication. Answer is warning. How about this one? The same option. The same option. Conditions and situations under which a medication should not be administered are found in the dash section of a package insert. A. Adverse reaction. B. Warning. C. Precautions. D. Contraindications. Conditions and situations under which a medication should not be administered are found in the dash section of the package insert. A. Adverse effects, adverse reaction, warnings, precautions, contraindications. Yes, the answer is contraindications, please. Not adverse adverse reaction. Adverse reaction is just side effects. Nah. You understand? Warning is, danger, fatal. Contraindication is don't take alcohol when you are taking Tylenol. That's contraindication. Oh, you see that place they write, avoid for pregnant women or avoid in children. You understand? That's warning. But don't take this with this. It's contraindication. Something that we have to react on. All right. You will see you see questions like that. Just be you don't worry, it's very superficial. Very, very superficial. Look at this question. The precaution section of a package insert provides what information? A. this, B, this, C, this, D, this. What's the answer? The precaution section. The answer is not B, please. The answer is C. Information about drug interaction and other conditions. Every condition that can cause unwanted side effects is known as what? Precaution section. Please. Look at this question. Oh, yeah, it's the same. I think it's the same image. Yes, Amiodaron. Yes, the same image as before. Yes, thank God. So I don't need to paste new picture here. So using the same image as before, this image you can see right now, the same image as before. Yes, it's the same image. I just want to be sure. Please answer this question. Based on the storage instructions on this label of amiodarone, which of these would you do? I'll give you options. A, this, B, this, C, this, and E. This. So based on the storage instructions on the label of amiodarone, which of these would you do? A, remove vials from the cartons and place in a well-lighted room. B, keep it in the refrigerator. C, keep the vials in the original packaging and avoid excessive heat. Then D, keep the vials in the original packaging and store in the freezer. Which of the options? Let me see. Continue. Yes, the answer is C. Very correct. Look at this question. I don't know if this is big enough, but let me try to expand. I believe this is big enough. Oh, I'm not sharing yet. Okay, look at the stuff here, all right? This is the stuff. Let me ask you the question. You have to be, when I'm answering these questions, you need to be very fast, all right? Because you may don't spend 1 hour in one question. This vial of Vantine was reconstituted in July 24. When should it be discarded? Yes, that answer is C. Yes. So which days after 14 days? We have August 20, August 8, July 31 on the manufacturer's listed expiration dates. Which dates exactly? That's what they're asking you. I know it's after 14 days. 14 days, August 8. Someone said no date. No, you have to You have to add it now. I know why you answered that because I talked about what was that? Heparin. So we have July 31, we have August 20, we have August 8th. Which one? I already gave you the option. I wonder why you're giving me answer that is not in the option. August 8th, July 31, August 20. Please, the answer is August 8th. If you add it, it's actually August 8th. If you do the mathematics, it's August 8th. Though. Look at this question, guys. Once reconstituted according to the instructions, how much solution is contained in the bottle of Vantine? You guys are so correct. The answer is 50 mg. 50 mg. Now look at this question. Yes, the answer is 50 mg. Yes. Look at this question. What information does the lot number contain? What information does the lot number contain? This is A. This is B. This is C. And this is D. What information does the lot number contain? The dosage strength of the medication A, when and where the drug was produced B, how much medicine is in the bottle C, the US patent number of the drug D. Let's go, guys. Wow, you guys are on fire. You guys are really on fire this night, man. Yes, the answer is B, where and when the drug was produced. So look at this question. It's a picture question. This is the picture here. Please, whenever you see these pictures, I don't want you to be afraid of the picture. Conquer your fear. I am now a motivational speaker. Yay! Okay, look at the question here. Look at the question here. What are the reconstitution instructions for this medication? What are the reconstitution instructions for this medication? Let me give you the options. Let me give you options, all right? It's A. This is B. This is C. And this is D. What's the answer? What are the reconstitution instructions for this medication? A, add in 250 ml water in 3 portions. B, add 5 ml water. C, add 45 ml saline in 2 portions. D, add 60 ml water in 2 portions. Yes, you guys are so correct. All right. Add 60 ml into portions. You guys are so correct. Look at this particular question. What instructions are provided on the label? I'll give you option. I'll give you option. Yes, you guys are correct. That's D. So this is A, option A. This is option B. This is option C. And this is option D. What's the answer? What instructions are provided on the label? Hurry up, guys. Hurry up. Let's make it faster. You know, when it's not a lot of this thing, I will be waiting for you and we will be wasting a lot of time. And I really want us to move. You guys are very correct. You guys are very correct. The answer is shake well prior to use and keep lid on tight. That's A. So look at this question. This question is not with that diagram, but look at this question. It's a bonus question. It's acceptable to break which of the following forms of medication? Which one are you breaking? What will make you break a medication? Are you waiting for option? Tell me you're waiting for option. Please, the answer is called. Please, the answer is called. All right. What are you asking? Someone is asking what I'm asking. The question is there now. Is it acceptable to break which of the following forms of medication? It's called medication. Now, with the diagram I just posted, look at this question. With the diagram I just posted, which of the following is the dosage strength for furosemide? Ample. Are you breaking amples? Is that what you're asking? If ample can be broken? I guess that's not what you're asking. Maybe you can clear up the question so that we understand what you're asking. So, which of the following is the dosage strength for furosemide pictured here? Answer, guys. Okay, what you're asking is the one that they do palm like this. No, they are just breaking the bottle. We are talking about tablets when you break the drug itself. All right, it has to be scored. I mentioned it before now when I was telling you the story of the friend. Not really a friend of mine, but somebody I saw trying to, get equal size by reducing the drug itself. Can't see the picture. Why can't you see the picture? I got that, but thanks. Okay. Can't see the picture. Why can't you see the picture now? I made it big. I don't know how else to do it. Let me see. I don't know how else to make zoom this picture. I think it's better now, I guess. So yes, you guys are correct. Let me see what you wrote. 40 milligram per 4 meals. Yeah, that's correct. Not 40 milligram per meal. Somebody wrote 40 milligram per meal. It means 40 milligram per 1 meal, but this is 40 milligram per 4 meals. Okay. Look at this. I got that. Okay, thank you. Look at this. Furosemide shown here is an example of options. A, B, C, D. So this furosemide, when you are reading this, all right, the furosemide shown here is an example of a multiple dose vial, a medication that needs to be reconstituted, a medication that's administered IM only, a single dose vial. Come on, guys, let's go. Fire it, fire up, fire up. Someone say D, 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 D. You want to confuse me? Let me think a lot of people are writing. The answer is D, actually. Oh, somebody is still in the other question. 40 milligram per 4 mil. Yes, you're correct. But for this other question, the answer is D, actually. That's a single dose vial. You still using this thing? Still using it? Answer this question for me. The furosemide is an example of dash. Let me give you the option. A, B, C, and D. So if you just look at the paper, you will see what we are talking about. Exactly. You guys are so correct. The answer is C. Look at this question. Still the same picture. What is the manufacturer of this? Who is the manufacturer of this vial of furosemide? Who is the manufacturer? Caraco Pharmaceuticals, Pfizer Labs, Total Care Pharmaceuticals, Abbott Laboratories. Total Care. That's good. So you need to be able to identify this. You understand? You need to be able to identify this. It's extremely important because if you are not, it becomes a problem. Okay, look at this diagram. Please, when you see diagram, don't be afraid. I know somebody, I heard you. I heard you. Somebody said, Jesus, what is this? I heard you. You're already afraid. Don't be afraid. Christian is always superficial. All right? They're just trying to intimidate you. Don't intimidate. Don't allow. Don't allow it. What you should do now is go and drink cold juice. You should keep cold juice beside you. All right? So that when you feel too saturated, you unsaturate yourself. Look at this question. What is dosage strength for this fentanyl patch? Quickly, guys. What's the dosage strength? So please, I see some people making a mistake. Some people are writing 100 mcg. The answer is not just 100 mcg, it's 100 mcg per H. Now, in that option, in the options, you will see just 100 mcg in option 1. Option A, you will see 100 mcg. There's a difference between 100 mcg and 100 mcg per H. You understand? So, like, they are trying to confuse you with this very minute test information. So, please, all right? Please take note of that. What is the route for the administration for this product? What's the route? Quickly, guys. Okay, yes, that's transdermal. That's transdermal. You guys are correct. Look at this one. Yes, that's transdermal. How much fentanyl is contained in each transdermal system? Yes, that's transdermal. You're correct. That's transdermal. Oh, somebody is still in 100 mcg per H. Yes, you're correct. I just posted the same question actually. How much fentanyl is contained in each transdermal system? How much? How much? How much? We have 100 mcg, we have 10 mcg, 10 mg, we have 100 mg, we have 5 mg. 100 mcg options, so pay attention to the options. 100 mcg, 10 mg, 100 mg, then 5 mg. Answer. Answer, guys. Answer, guys. Hundred mcg, 100 mcg. This fentanyl system transdermal 100 mcg per H. 100 mcg per H is different from 100 mcg. 100 mcg per H is different from 100 mcg. Each transdermal patch is not 100 mcg. Mcg is microgram. And if you calculate it, pay attention. Look at it very well. They said 100 mcg for 72 hours. 100 mcg per hour for 72 hours. All right. So they are telling you that, let me see. A transdermal patch, fentanyl transdermal system is 100 mcg per hour. 100 mcg per hour. Per hour, 72. Let me see. How many hours here? 72 hours. 72 hours per hour, 100 divided by 72. No, the answer should not be 100 mcg. The answer to this question cannot be 100 mcg. 1, 2, 3, 4. Hold on. No, the answer to this thing cannot be 100 mcg. This question is not correct. In vivo delivery at 100 mcg fontanelle for 72 hours. No, the answer cannot be 100 mcg. It cannot be 100 mcg, guys. So let's keep this question. Maybe we'll treat it at the end if I'm able to see the right question. But this cannot be the right question. I have my reasons. All right, because that thing said 100 mcg per hour. 100 mcg per hour is different from normal 100 mcg. So it can be. It can be. They are saying it's 100 mcg, but me, I'm saying it's not correct. It can't be the answer. So please don't pick it. Don't. Avoid it. All right? Later, I will try to solve it and see how many mcg one transdermal is actually. It can be unboxed in fine print. No, listen. 100 mcg is what you have in the option. All right? But what you have in the option, what you have in the on that fine print you are talking about is 100 mcg per H. You understand? Per H. That per H has already made that 100 mcg not to be the answer. That's what I'm trying to tell you. So what you should be thinking about, oh, that transdermal patch, right? How many hours does it have? I don't know if you understand my point. How many hours? Assuming maybe they indicated, okay, each transdermal patch is so and so hour. Then you can now convert that how many mcg by that hour and know the amount of mcg. Do you understand? So that's the thing. You have to do the conversion. And when I'm doing the conversion with 72, I'm not seeing the option, the answer in the option. That's what I'm trying to tell you. That's why I say leave that for now. All right? Okay, I don't want to waste time with it. But I just need you to understand what I'm talking about. So I will show you a different image. So please just avoid that image for now. I'll look at it later. All right? Look at this. Don't worry, I'm coming back to that question. So look at this particular question. I'm just trying to move forward so that we don't waste too much time talking about one question. Look at this question, guys. You say 33. It's not in the option. That's the problem. Look at this question, guys. How is this medication administered? How is this medication administered? So we have by oral inhalation, by transdermal via patch, intranasally by drop, and orally. Still looking at that question. 100 mcg per hour, 72 hours. So 100 mcg per hour for 72 hours is 7,200 mcg, right? 7,200 mcg. 7,200 mcg divided, converting it to That option is in milligrams, right? Just give me a moment, please. That option is in mg. 7,200 mg divided micrograms divided converted to milligram is 7.2 milligram. So that option is not there. Each transdermal patch, they say, is 72 hours. It lasts 72 hours. Right? Yes, each transdermal patch is 72 hours. And they are telling you that this thing is 100 mcg per hour. So it will be 100 times 72, which is 7,200 mcg. And when you convert it to milligram, which I'm looking at the option now, we have 100 mcg, 10 mg, 100 mg, 5 mg. It will give you 7.2 mg. So the answer is not in that option. So it cannot be 100 mcg. That's what I'm just trying to tell you guys. Anyway, that's by the way. That's by the way. So let's you will not be giving something that will confuse you like that. So this question by oral inhalation, right? Look at this. What warning is on the label? What warning is on the label? A, do not refrigerate. B, keep in lighted area. C, do not shake. D, do not puncture. Very fast, guys. The option again: do not refrigerate, keep in lighted area, do not shake, do not puncture. What was the information? What did they ask you? Come on, guys, let's go, let's go, let's go. We're almost done. Do not puncture. Yeah, you're correct. So what about this? Very fast, guys. I believe everybody must have known how to read this thing properly, all right? What dose of this is delivered with each activation of the inhaler? Come on, guys, let's go, let's go, let's go. What dose? Keep out of the reach of children. No, yeah, it's do not puncture. From the options, you're answering from the options. Let's go, let's go. I want to give you the last picture, then we jump to the last this thing quickly and we finish that last chapter. It's very short. 250 mcg. Yeah, you guys are very correct. You're very correct. So please, this is the last image. I told you the images are very, very important for this particular. Is it too big? I think it's too big. Let me reduce it. In fine print, each activates in fine print. Okay, I believe you guys are able to see this. So I'll give you just 2 questions from it, or 3 questions, and we are done with this. Look at this, guys. What is the total amount of medication in this container of methadone hydrochloride? What's the total amount? Quickly, guys. We have, let me give you the options. 10 mg, 10 mil, 20 mil, 200 mg. Yes, do not puncture. You're correct. Do not puncture. Yes, that's correct for that question. Yes, guys, it's 200 mg. It's very clear. It's crystal clear. Okay. You say what? What did I ask now? What is the total amount of medication? And this container of methadone. And it's asking you all the medication. Like, what's the total strength? Total. You understand? Not strength for one. Usually, when we say strength, you're talking about one particular content of them. Maybe if they say 30 tablets, you say, the strength of one tablet is 10 milligram of that drug. But here they're asking you what is the total thing. And there they mentioned the total content is 200. All right. So look at this question. Referring to the label, what is the usual dose for methadone hydrochloride? Oh, was that the same question I asked before? Yes. Oh, God. What is wrong with me? Referring to the label, what is the usual dose for methadone? Okay. Option 10 milligram. The usual dose is not listed on the label. 20 ml, 200 mg. What's the answer? You say I'm getting tired. Yes, I am, kind of. That's why I'm trying to hurry up. So listen, look at the question, guys. Always understand your question. They say referring to the label, what is usual dose? Did they write any usual dose in this thing? No. They did not write any usual dose in that thing. You understand? They didn't write the usual dose. Now that place you say, you're like some of you are saying 10 mg per ml. That's just the strength, right? In 1 ml is 10 milligram. In 1 ml is 10 milligram. And the other question is asking you how many, what's the strength for everything? That's 200. But here they're asking you, referring to the label, what is the usual dose? You see, the idea of this thing, listen, guys, I just want you to get the entire concept. The entire concept, you see, I give you a lot of pictures. You keep looking. Is for you to build being careful when you are looking at a medication. You have to be extremely careful. You understand? This is healthcare. If you make a mistake, you can kill somebody. All right? So all this thing is just all about telling you you have to be careful. You have to be careful. If you notice, virtually all the images, the same question. You understand? So that you have a lot of repetitions. All right? So this is the last question for this. All right? That's the last question. So quickly, this last chapter, we'll do it in 20 minutes. Guys, I'll ask you very few questions there. Please, if you permit, so that you guys can go and rest. I know you are tired. Don't say I'm tired. Somebody's saying I'm trying to run away. I'm not trying to run away. Yes, and please, that other question I asked you before, I was telling you the answer is not 300 mcg or whatever. The answer, you have to convert it. You have to do it based on the hours. All right, and it's 7 point something. It's not even in the option. Somebody saying no usual dose. Exactly, no usual dose given. Of course, they can't be giving you usual dose. What do they even mean by usual dose? That's just a question to trick you. Don't fall for it. Don't fall for it. So the last, this thing is chapter. Which chapter did we do now? Chapter 10. Okay, the last one is chapter 11. Safe med. This one is very straightforward. Very, very, very straightforward. I don't even think I need to explain anything, but let me just do it because of the sake of people that are not in my session. And, we have a lot of people from countries right now. Okay, look at this. It's very, very brief, all right? I'll just jump. It's safe administration. Everything is about safety, right? Because as I keep telling you, if you don't do the right thing, you kill someone. right? And there are people that are going to watch you, and those people are ISMP, Institute for Safe Medication Practice, Physician Dex Reference, PDR, the Joint Commission, TJC. These are the people that will look out for you. They will hold you, they will choke you, and they will take your license and put it in the fridge. Yes, don't let them trap you. Yes, you understand? So there's something called transcription. There's verbal order. All right? Verbal order, transcription. You need to know when it's the right time to do something. All right? We have prescription, we have transcription, we have 3 checks, we have rights, we have observation, we have patient teaching. These are the things you have to know. All right? Everything is all about safety in terms of administration. Verbal orders is when I call you, nurse, let me see who is here. Nurse JB. Nurse JB, please, I want you to give this patient 200 milligrams, so and so, IV, all right? Please check the reaction, blah, 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 blah. Do you take it or do you not take it? When am I qualified to give you that instruction? Or when are you qualified to receive that instruction? That's what we are talking about here. So verbal orders are used when an authorized prescriber is unable to write the order. Maybe I'm in Nigeria enjoying myself, eating fufu and egusi soup. And you are here running helter-skelter for a patient. And you understand the point. Some of you will be nursing practitioners. You will have your own clinics. And you will go to Mexico, to Cancun. I want to go to Cancun. Who is going to go with me? So you go to Cancun and you just make call and call your clinic, or maybe you guys will be physician assistant. You call your clinic and say, yes, please, give so and so medication, give IV fluid, 0.9% dextrosaline, give blah 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 blah. How many meals? All right. So when you are not available, you can give on phone. All right. And orders must be carried out quickly. I won't tell you on phone to give order for next week. No. If I tell you on phone, it is because it's an emergency. We need to give that order now. You understand? So it must be by an authorized prescriber, and also it must be documented. You must document it by Dr. So and so. You have to write it there. All right? So the TJC, they write the order as you receive it. That's what they say. Write the order as you receive it. Don't correct anybody. In short, after receiving the order, read the order back to the authorized prescriber so that he will agree that that's what you gave. All right? Read the order back to the prescribing practitioner. Confirm the order with the prescriber. Extremely important. Extremely important. All right? Now, you need to know that handwriting differs. I don't even see my handwriting. My handwriting is one of the worst on earth. I'm telling you. Hold on. Let me remove this so that it won't. Okay. So you see, these drugs, they look alike. So you need to be sure. Sometimes you pronounce the drug. Look at the doctor's signature handwriting. This is a physician's handwriting. Can you even see anything here? This thing is a little better than mine. Small thing is better than mine, yeah. But don't guess. Please, if you don't see anything, call that prescriber back or take it to the desk of that prescriber. Please, I don't see this thing. There's no shame. Don't guess. Don't guess that this thing looks like 8 or 3. Is it 3? Is it 8? I think it has to be 3. Don't do that, though, so that you don't kill somebody. Saying it now. So this is transcription, all right? Prescription label, medication label. Transcription is the process of transferring information from the prescriber's order to, prescription label or medication admission record. Some people right now are serving as scribes. I was talking to a friend of mine today. He's a scribe. He's working as a scribe right now. All right? So some people do that. So if unsure, ask. Incorporate transcription. Incorrect transcription is a major cause of medication error. So you have to be clear about what you are doing. This is an example of MAR. You have to be clear. All right. So 2 organizations promote safety in this regard. TJC, do not use list. ISMP, list of prone error abbreviations. They are telling you abbreviations that we've known that people mistake a lot. All right. For example, you are writing something. You want to write 1 milligram. You write 1.0. Please don't write 1.0. Somebody can mistake it as 10. Or because you know that 0.5 and 0.5 is the same thing, you write 0.5. So these are the things that you can see error in, like HCT. Somebody can think it's hydrochlorothiazide, you know, QOD, OU, you know, all those things, 0.125. You see? So, threes of medication. Match the MAR when medication is taken from storage. Check when you prepare the medication, and check before closing storage container or just before administering the medication. Very, very important. All right. Now, these are the things to present there. You see all these rights. After these rights, we are done. Right patients. You have to make sure it's right patient, right medication, right dose, right route, right time, right documentation, right reason. And the patient has the right to know, the right to refuse, and you must use what? The right technique. That's what they're telling you. So everything about rights, right patients, you must check the patient's what? Full name and match it with any of these ones. Either full name with date of birth, full name with SSRN, full name with medical record number. All right, that's right patient. Then right drug, you must make sure that this is the right drug. And you must calculate the dose. All right, depending on the equipment you are using to deliver that medication. You can be delivering with an equipment that is in milligram, but they gave you that drug in microgram. You have to convert. You have to check the proper routes. If you are not sure, if you don't, they didn't write it, go and ask. And you must always give it at the right time. The right time is within 30 minutes of scheduled time. Some people say 1 hour. That's what they teach. But please, it is within 30 minutes, plus or minus 30 minutes, not plus or minus 1 hour. All right? So that's right time. Then we have right documentation. You have to document properly. All right? So sometimes some patients can refuse. Patient refusal, please document. If you give only a partial dose, please document. If the patient vomits shortly after taking the medication, document, because it means that there's every probability that the patient must have vomited that medication. All right? So patients also should know the reasons why you are giving a particular medication. And you, as the person that's giving that medication, you should also make sure that, oh, this medication they are giving, oh, this patient has been diagnosed of sepsis. Oh, this doctor is giving antibiotics. Okay, that makes sense. Good reason. All right? Good reason. Not giving sleep medication when the patient have infection. You know that there's a problem. Maybe the doctor is angry, so his mood is affecting his prescription. Maybe he made a mistake. But don't correct it. Go and meet that prescriber. All right? And the patient has right to know. The more you teach your patients, the better for you. The more, it's always said in the clinic that if a patient makes a mistake, that mistake is on the provider. You are the one that didn't explain well. All right? So you have to explain well and ask that patient question, because some patient may have language barrier and you will not know. And the patient can say, I don't want to take this drug. You cannot force that patient. Don't close the nose of that patient and force the drug into the patient's mouth. Don't do that. My mother did it a lot. I hope she doesn't hear this. She hold your nose down. She put the medication. Okay. And right technique is very, very important. So you have to know all these things. Make proper observation. Patient teaching is very important. These are the things you have to teach. Okay, so that's it. As I told you, it's very brief. All right. So how many people do we have here? 35 people. Okay. So I'll give you very few questions, not a lot. Few questions, and we'll be done. Some people are like, please, these guys should just stop talking. Like somebody's like, what the hell? This guy has been talking for so long. Please, what's the problem with this? What's the problem with this? Identify the problem with the other Rostril 7.5 milligram, 1 capsule, POQHS. What's the problem with that order? Let me give you option, because I know you may need option. Please, everybody has to attempt. I want to make sure that everybody is here so that I'll be able to continue. Right? You know, when you guys are here, it gives me strength. Don't go and sleep. Don't sleep on me. Somebody's wake up. Wake up. Wake up. Wake up. Somebody's sleeping. So that's B. Then this is C. This is C. Somebody say A. I've not finished. Then this is D. Yes, now somebody is sleeping. Wake up. Wake up. Wake up. You see? Now that I say wake up and hit, we've gone up from 30 something to 43. You see what I'm saying? You see what I'm saying? Identify the problem with this medication. With this prescription. Identify the problem with the other Rostrio 7.5 milligram, 1 capsule PO QHS. Come on, guys. Only 5 people typing. Why now? Are you tired? If you are tired, we can stop. Only 5 people are typing. Why? There is no problem with the patient order. Dosage strength is not specified. Route is incorrect to dosage form. You are making tea. You are hungry. I wish I can eat by this time. Oh. If I venture take anything by this time, it will give me 5 pounds. My body can retain fat so much. I wish I can eat by this time. I will just sleep and I will eat in the dream. Hey, I'll eat in the dream. So the answer, you guys are very correct. The answer is D. The error-prone abbreviation QHS is used. Yeah, I know you're tired. I'm so sorry. I'll give you maybe 15 questions here. So, look at this question. This is the question. Option A. This. Option B. This. Option C. This. And option D. This. So the patient is ordered heparin 5,000 units SubQ daily. Is this order correct? A. There is no problem with this order. B. SubQ is an error-prone abbreviation. C. Route is incorrect for dosage form. D. Dose is incorrect. Come on, guys. Come on, guys. We're up to 40 here. Come on. You have to motivate me. Okay, guys, are you guys activated? You need to be activated. The answer to that question, the answer to that question is very correct. Is B. SubQ is an error-prone abbreviation, and people use it a lot. Trust me, they use it a lot. See somebody there is SubQ. Say SubQ. See, I'm not going to ask this question. I'll just tell you guys about this question, so that will be very fast. There's a question they are asking: documentation of medication administration should be done when? The answer should be immediately. After you administer the medication, immediately after. That's when you document, not before. You can't document something you've not given. You understand? You document immediately what? After. So I'm not asking that question so that we don't waste time. Look at this question, guys. Look at this question, guys. Based on the recommendation of the Joint Commission and ISMP, which of the following is the preferred way to abbreviate morphine sulfate? A, MS. B, it should be abbreviated C, MSO4. D, MSM sulfate. A, MS. B, it should not be abbreviated. C, MSO4. D, MSM sulfate. Come on, guys. Options. Give me the answer. Give me the answer. Let's go. Let's go. Let's go. Don't tire out on me. Where are you going to? Why are you logging out? Come back. Come on, guys. What's the answer? Yes, the answer is B. You guys are very, very correct. I missed the answer to the heparin question. My computer froze. Later, just watch it, all right? I can't remember the question we are talking about. I don't have it by heart. But later, just watch it so that we don't need to waste time going back. The video will be there on YouTube, all right? And I always read out the question. So even if you don't see the right thing, you will hear the question. If possible, remember the time so that it can be easy for you to catch. A healthy provider has a responsibility to tell a patient the reason for taking the medication, the effect of the medication, and the side effects of the medication. Which right is this? A healthy provider has a responsibility to tell a patient the reason for taking the medication, the effect of the medication, and the side effects of the medication. Which right is this? A, right reason. B, right to know. C, right drug. D, right technique. Let's go, guys. The question is very simple. Trust me, it's cheap. You just need to focus. Everything is focused. Don't have an anxiety. Whenever you are entering any exam, no anxiety. All right? No anxiety. Anxiety reduces your score automatically without you even trying. Yes, the answer is right to know. The answer is right to know. The answer is right to know. So look at this question, guys. The physician's order does not include why a medication is to be given. The healthcare provider administering the medication will not be able to fulfill which right of medication administration without clarifying the order. A, right drug. B, right reason. C, right to know. D, right documentation. The morphine answer is, I don't really know. You do really need to go back to the video, right? Immediately after the stream, the stuff will be there, so you can easily just go back and do it. All right. I don't know what you're asking by heart, and we've already moved from it. The physician's order does not include why a medication is to be given. The healthcare provider administering the medication will not be able to fulfill which right of medication administration without clarifying the order. A, right drug. B, right reason. C, right to know. D, right documentation. Come on, guys. Let's go. Let's go. Let's go. I have only 2 people. You guys, come on, come on, come on. Stop sleeping. Stop sleeping. Stop sleeping. Stop sleeping. Stop dozing. Somebody is almost using the head to break table. Like some of you that are working in home care places, you give medications, all right? And this is, people go to special training for it, but we are doing it in one class. Which of these is, okay, yes, the answer is right reason. You're correct. Look at this question. Which of these is not one of the 3 times a medication is checked? Which of these is not one of the 3 times a medication is checked? A, when it's documented. B, when it's replaced on the shelf, C, when it is removed from the shelf, and D, yes, reason, yes, right reason, and D, when it's prepared. Which of these is not one of the 3 times a medication is checked? Which of these is not one of the 3 times a medication is checked? Medication has to be checked 3 times. A, when it is documented. B, when it is replaced on the shelf. C, when it is removed from the shelf. D, when it is prepared. Which? Come on, guys. Are you tired? So the answer is A, when it's documented. Like it's documented. What are you checking? No. You understand? But you check the other 3 times. Look at this question. Checking a medication 3 times, ensure which of the following? Checking a medication 3 times, ensure which of the following? A. Hold on, guys. Yes, the answer is A there. A, this. B, this. C, this. And D, this. Checking a medication 3 times ensures which of the following? A, the order was transcribed correctly. B, you know how to administer the medication as ordered. C, the order is correct. D, you have the right medication in the correct dosage form. Okay, you guys are so correct. The answer is D, you have the right medication. It's not A, it's not B, it's not C. All those are talking about the order. Okay, I'm talking about the medication here. All right, extremely important. Look at this question, guys. In which of the following situations would a verbal order be acceptable? I'll give you the option. A, B, C, D. In which of the following situations would a verbal order be acceptable? A patient is requesting a laxative and the physician is only available by phone. B, a patient has an extremely high blood glucose, but the physician is performing a sterile procedure on another patient. C, a patient is requesting medication for pain. The physician is having coffee in the conference room, sipping coffee. D, why at the patient's bedside, the physician says to take a verbal order for an antihistamine. Yes, you guys are very correct. A patient has an extremely high blood glucose, but the physician is performing a sterile procedure on another patient. So that's an emergency. All right. It can't wait. Okay. So this is considered one of the main causes of Look at this. This question is more theory than it's stressing me. I'm going to read this question or the option out, so pay attention. Which of these is considered one of the main causes of medication errors? Are you asking the answer for the other one? The answer for which question is that? In which of the following situations would a verbal order be acceptable? Is that it? Yes, the answer is B. A patient has an extremely high blood glucose. High blood glucose, maybe that patient is type 1, all right, for example. And if you don't, assist that patient, it can go in coma. But that physician is performing a sterile procedure, all right? So he can't even touch any other thing at that moment. So that's why, it has to be the answer. It can be a patient is requesting a laxative and the physician is only available by phone. No. You understand? It doesn't make sense. A patient is requesting medication for pain. Requesting. While at a patient's bedside, the physician says to take a verbal order for an acting. It doesn't make any sense. All those things does not give the sense of emergency. All right. So at those moments, the patient should go and write it down. The physician should write it down. But for that other high blood glucose, and because he cannot touch anything, he can now give oral order. That's what they are just asking you there. So once an order, where is the question? Which of these is considered one of the main causes of medication errors? I'll give you the options, guys. A, patient non-compliance. That's A. B, order filled wrong by the pharmacy. C, incorrect transcription. D, incorrect patient identification. Which of these is considered one of the main causes of medication errors? A, patient's non-compliance. B, order filled wrong by the pharmacy. C, incorrect transcription. D, incorrect patient identification. Yes, the answer is C. That's incorrect transcription. You guys are very correct. So I have just very few questions and we are done, guys. Very few questions. You've really tried. Like, you guys stayed up to 30 something of you stayed till now. That's massive. So look at, guys. Look at this question. This is part of the questions you'll be given. I hope you guys can see it clearly. I'll ask you the questions following it. All right. If you get something like this, all right, you have to be very careful. And don't let it intimidate you, because that's the problem. People allow questions to intimidate them. Thank you for your energy. You're welcome. You're welcome. Look at this question, guys. Look at this question. Which entry on the MAR was transcribed with all the necessary information in the correct format? Which one? Options: probentine, dilantine, digoxin, none. Probentine, dilantine, digoxin, none. So this question will require that you look at that prescription and know which one is lacking or which one is not lacking. So take a minute to look at it. So you have to be extremely careful with this. All right. Yes. So the answer is none, because if you look at it, look at Dilantin. They say 125 mg Q 2 Q12H. All right. What is the route of administration? None. It's not there. So that makes it out. Look at the next one, closing 225 IV Q6H. 225 watts. Is it milligram? Is it male? All right. So that one is out. Look at digoxin. It has QOD. That QOD is even out. Abbreviation, wrong abbreviation. Like the abbreviation does not make sense. All right. It's an error-prone abbreviation. Then look at the last one, 15 mg PO. 15 milligram per hour. When? All right. When? What's the frequency? So all of them has a problem. That's what we're trying to tell you. Exactly. Look at this. See? Look at this. Which entry on the MAR was transcribed without a route? Which one? Which one has no route, guys? Which one? Let me see. Yes, yes, Delantin. Yes, yes. You are very, very correct. If you look at it very well, Delantin is without routes. Look at this question. Yes, Delantin without a route. You are correct. Look at this question. Let me see who gets it. What is the problem with the transcription for digoxin? Digoxin. Digoxin. How do they even pronounce that thing? Yeah, I call it digoxin. Well, it sounds like somebody's name. Ngozi. Everybody's abbreviation no good. See every other day, the Lantin. Yeah, the Lantin is correct for that question. The Lantin is correct for that question. Yeah, that's the question we passed. So, but this one is asking us what's the problem with the prescription for digoxin? No, not frequency. The answer is that QOD. All right. The answer is that QOD. QOD is an error-prone abbreviation. The option is there is no route given for this medication. There is no dosage. The dose has a leading zero. The answer is what? QOD. QOD is error-prone. All right. Look at this question. Still on the same picture. Still on the same image. Look at this question. Yes, abbreviation. You are very correct. Look at this question. Which transcription is missing the frequency? Which one is missing frequency? Come on, guys. Which one is missing frequency? Dig. That's digoxin. Digoxin. No, the digoxin has frequency now. It says even days. The answer is probentin, guys. Yeah, the answer is A, B, C, D. Yeah, the answer is probentin. All right. Please, you have to be careful when you are picking your answer, because sometimes these mistakes some people are making is in the option. That's the problem. All right. Some people will be like, oh, if I see the options, I'll get it. No. Sometimes that mistake you made is in the option. What is the problem with the transcription for cleosine? Cleosine. Did you say no route? There's route there now. IV is in a route. IV is route now. There's actually dosage there. What is actually missing is not the dose. What is missing is the unit for the dose. Yes. What is missing? No, they said 225 IV. They are telling you, oh, inject 225, but 225 watts is unit for the dose. That's the problem. All right. Because the dose is missing, is in the option. The dose is not missing, it's there. That's why I said some of the mistake, you can see it in the option. That's how you have to be careful. Please. You can't afford to fail any of these questions. You have to be careful. Yes, thank you. It's missing the units. It's missing the units. Okay. Let me give you just 5 more questions and we are done for today. Just 5 more questions, please. Bear with me. Yeah, you would have gone. So that's the point. I don't want you to get this kind of question. That is the idea. Yes, that's the idea of this our discussion. Listen, some people think I'm here to teach. I'm not here to teach. I'm here to bombard you with a lot of questions so that you'll be cooked. I want to cook you. You understand? So that when you bring out the food will be sweet jollof rice. All right? Very done, very spicy. Amena jollof. You understand? It's a very type of jollof, very special. We call it Amena jollof. Okay. Roughly 75 questions or to 100, between 75 to 100. I see, that's why I'm taking a lot of time. So this question is a long question. So you have to look at it. This is the continuation of the question. Hold on. So this is the question. This is the question. Now I'll give you the options. All of you need to start looking at the question immediately as I'm giving the option. This is A. This is B. This is C. And this is D. So I'll read it for the benefit of people that will look at this video later. Mrs. Anderson was given medications on the units. Mrs. Anderson was given medications on the units just as she was taking a medication out of the patient's cassette. She was interrupted by another patient asking about an appointment. While having the discussion, she opened the medication container and poured the dose and gave it to the intended patient. When she returned to the cassette, she realized she gave the wrong medication. What did she neglect to do? A, she neglected to properly identify the patient. B, she neglected to perform the 3 checks of medication administration. C, she neglected to properly document the medication. D, she neglected to ensure the dose was correct. Yes, you guys are very correct. The answer is B. She neglected to perform the 3 checks of medication. So you have to know that it is the person that is giving that medication that has the duty to perform that 3 check. All right? Is that patient? I told you I'm giving 5 questions. This is 1. So 4 questions remaining. Four questions to go, guys. Then I'll leave you. This is the question. I'll give you the options. This is A. This is B. This is C. And this is D. So which of the following observations will be made prior to administering an oral medication? A, the temperature dropped in a patient receiving acetaminophen for fever. B, the patient is alert and able to swallow solid food. C, the patient vomited immediately upon taking her medications. D, the patient reports relief of pain and is resting comfortably. Where is everybody? It's just two people that are answering this question now. Where is other people? You guys have run away. Where are you guys now? Which of the following observations will be made prior to... If you guys are tired, then I can stop. I want to ask 4 more questions. So I need everybody to comment. Which of the following observations will be made prior to administering oral medication? The answer is B. You guys are very correct. The patient is alert and able to swallow. You can't be giving oral medication to a patient that is not swallowing. So that's remaining 3 more to go. Please, I need everybody to come back. Where are you guys now? Just 3 more to go, and you go rest. This is A. This is B. This is C. This is D. Answer. You observe that Mrs. Ego is becoming more lethargic. Which of these would not occur as a result of this observation? You observe that Mrs. Ego is becoming more lethargic. Which of these would not occur as a result of this observation? A, the route of administration may have to be altered if she is not alert enough to take oral medication. B, the medication may have to be held until she is more alert. C, you would go ahead and give the medication. D, you should check to see if Mrs. Ego can swallow solids before giving oral medication. Are you choosing D or you are choosing A? You wrote A. Then now you're writing D. Which one is the answer? He says it's tricky. So listen, when a question is tricky, look at it, understand the question, then pick your answer. Because sometimes I find out that there are some students, they know the answer to this thing, but because, they'll just choose something wrong, all right? So the answer should be C. Yes, some people say C. The answer should be C. You observe that Mrs. Ego is becoming lethargic, right? They say, which of these would not, mind you, would not. So he's becoming lethargic. Would you go ahead and start giving medication? No. You understand? So the answer is C, all right? Yes, it's C. So I have 2 more questions for you. Here is an observation that might be made following the administration of medication. Look at this question. This is a giveaway now. This is testing the microphone from the back. He says, yes. Which of the following promotes patient compliance with medication regimen? These are the options. This is A. This is second to the last question. So if you are not here, wake up, wake up. This is B. This is C. And this is E. So which of the following promotes patient compliance with medication regimen? Ordering medication to be taken at multiple times a day, educating the patient about his medication, telling the patient to take the medication because the doctor ordered them, explaining that the doctor knows best. Oh, that's good. Yes, you guys are extremely correct. The answer is B. Educating the patient about his medication. You must, I've told you, if you are able to teach your patients, like in the clinic, you see, I have a board in the clinic, where I write on. So if you the way I talk to you right now, that's the way I talk to patients. That's the way I teach patients. I take time. I take my time. Honest, I play, I joke, I laugh. You make the patient comfortable. You have to make your patient comfortable. Sometimes if your patient is not comfortable, they will not be able to tell you things. Trust me. Make them see you as a friend and not as a doctor or as a nurse. You put your shoulder like this. You have to bring that shoulder down, all right? Just educate them, teach them. And after that, tell them, oh, repeat yourself. Like in the United States, New York, for example. Yes, New York, for example, there are a lot of patients from different cultural background. When you finish, tell them, can you tell me how you take this medication? What did I say? Let them repeat. Because sometimes you see a Spanish person that is not that understands English, but they don't have deep understanding of English language. Or even maybe a Nigerian, for example, maybe the person is Igbo like me and I don't understand English properly. You understand? You have to tell the person, okay, can you explain? If that person is not able to explain, you can look for someone that is having the same language of that patient to talk to that patient about it. All right? Yes, sometimes they will say yes, but tell them that's why you have to ask them. If they do you understand, they will say yes. So what did I say? That's it. But you have to be respectful so that they don't feel like you are condescending them. You have to be extremely respectful and smile. You say, you know what? I want to know if you understand me properly. All right. I hope that's okay. Yes. Okay. So tell me, how did I tell you to take this particular medication? Do you understand? So last question, guys. I know somebody is so happy. And funny enough, this question is very funny. It's funny. Look at this question. Yeah, that's the question. Thank you. This is A. This is B. This is C. This is D. Which of the following is not part of the basic information a patient should be taught about her medications? You see why I am sure that anybody that is answering this question is laughing right now. A Nigerian doctor saved my 93 years old grandma with COPD. So much respect for you guys. Hands in the air. Hands in the air. Yeah. No, Nigeria, we have wonderful people there. The only problem is just assuming the government is good. I don't really like talking about the government, but sometimes we have to say what we have to say. If the government is good and they invest on infrastructure, health infrastructure, it will be wonderful. Our problem in Nigeria is not the personnel, it's the equipment, is the system itself. That's our problem, not the personnel. Because our doctors, they go everywhere in the world and they are the best. They are very good at what they do. They have strong work ethic. You understand? If you see a Nigerian doing something now, if you are doing something for 5 hours, that person can do it for 20 hours and he will not even get tired. We have that stamina. So, but the problem is just no equipment. Go to Nigeria, we are using things that you guys used last 30 years. That's what we are using right now. That's why all the doctors are running away from Nigeria. All my classmates, for example, it's either in the UK or in the US or in Australia right now. So I'm talking to you. The percentage of my classmates that are in Nigeria right now is like maybe 10% of the entire graduating class. So, it is what it is. So, yes, you guys are the best. And this is how we come to the end of our revision for today. The answer to that question is C, how to pay for the drugs. Everybody laugh when they see that answer. So I wish you success in your exam tomorrow or whenever you're writing that exam, this exam, anywhere you are. I remove my cap for you for staying to the end. So please try to subscribe to the channel so that whenever I start any this thing, even if I'm not your professor, you'll be able to whenever I'm going on live or whenever I post new video. I'm going to post a video on neuro. All right, for people that are doing AP, I'm posting a video on neuro this week and also on bone. So you have to be alert. All right, tell your classmates, tell everybody that you know that is in college, no matter where the person is in the world. All these things is the same thing. Dosage calculation is dosage calculation. Any nursing school, any medical school is the same thing. Nothing different. The same thing I'm teaching you right now. So you have to tell your friends so that they will subscribe to the channel, make comments, leave likes, and also click the notification. All right. Thank you so much. I appreciate you guys. All right. I will leave you guys and run away right now. We spent more than 4 hours. Jesus Christ. And it's just feeling like we spent 30 minutes. Okay. Thank you very much. I'll see you guys whenever we see. You said minimum 50 to 60. No, it's not possible. 20, 60. Okay. Maybe 60, 75. Maybe 20, 25. Maybe. Oh, it's 4 chapters. 15, 15, 15, 15. Okay. Or 20, 20, 20. Maybe 80. It depends on what the Spirit says. God bless you too. Thank you so much. Thank you guys so much. You guys are the best. Okay. Have a nice night. I don't know if I should end first or you guys have to go off first. Which one? If the weather is bad, will you? The weather is not going to be bad, all right? The weather will not be bad. I've checked the weather this thing. Don't worry. I always reach out to you through email. So, but don't count on it. The weather will not be bad tomorrow morning. I'll be today. Did I say tomorrow morning? This is already morning now. This is past 12. This is tomorrow morning already. All right. Take care, guys. Bye-bye. See you. Some people are waiting for me to end the stream first. Okay, let me end this first. I know. Go and sleep. Go and sleep. Go and sleep. Take care, guys. Don't forget to tell your friends, all right? Especially people that are taking the same course. Don't forget to tell them. And people in different colleges, tell them, all right? No matter the country. Good night. Bye-bye. Thank you. Thank you.